She said the medical is up there with them right now.
Yeah, this is Mitchell. We need rescue. Yeah, this is Mitchell. We need rescue. Yeah, this is Mitchell. We need rescue.
Okay, today is the 12th of March, 2013. It's about 4:20 p.m. We're at the Clay County Sheriff's Office Detention Facility, and I'm interviewing inmate Linus Gilbert Farr, and his date of birth is 8/28 of 1951. He is currently being housed in cell number 3, which is the cell next to cell number 2, where Mr. Lingenfelder, where inmate Daniel Joseph Lingsingbenger was being housed. We're going to take a sworn statement from you today, sir. And you say you've got a law degree and you've practiced law before?
Yes, sir.
Okay, you know, in Florida, a law enforcement officer can take a sworn statement from somebody under Florida State Statute 11710, right?
Yes, sir.
The only thing it requires you to do, sir, is that you tell the truth. I have no indication from you that you're going to do anything but tell us the truth. But at the same time, I want to swear you in, okay?
Fine.
Okay. Would you raise your right hand? You solemnly swear to tell the truth, the whole truth, and nothing but the truth?
I do.
Okay, under Florida State Statute 11710, I'm a state law enforcement officer, and I'm taking a sworn statement from you today. It's being tape recorded. And do you have any objection to it being tape recorded, sir?
No.
Has anybody compelled you in any way to give this statement, or coerced you or threatened you to give this statement today?
No.
Is this statement a free and voluntary statement?
Yes.
Okay. Mr. Farr, in your own words, I understand you're an inmate here at Clay County Sheriff's Office, and I understand you're currently incarcerated for, it sounds like prescription pills and fraud?
Correct.
And forgery?
Yes.
Okay. There was an incident that occurred today that involved Mr. Lingsingbeller, and he stays in cell number 2, and you stay in cell number 3. Is that correct?
That's correct.
In your own words, sir, can you tell us? I understand you're in a wheelchair today. Do you have the ability to stand up and walk?
Yes, a little bit.
And do you have the ability to stand up and look outside your cell?
Yes.
Okay.
And I have a cane inside my cell, too.
Okay. As you talk to us today and tell us what you saw or heard, be sure and let us know if you heard it, or if you saw it, or you saw it and heard it both.
Okay.
Okay. In your own words, sir, can you tell us what you either observed or heard today?
Well, my first recollection was started last night, sometime after midnight. Mr. Lingenbauer was making noise in the cell next door to me. He was carrying on, wanting to be able to get in touch with the lawyer, he said he was able to post bail, he wanted to get out. He wanted to complain because nobody was doing anything to help him. He also wanted to see a nurse. They came to him, the night shift officers came to him, which I heard them come to him, and I heard them give him an inmate request form, the standard form that they use here at the jail. He needed something to write with. He didn't have a pen or a pencil. They wouldn't give him a pen or a pencil.
And that's for safety reasons, right?
I assume that that's exactly what it was.
Okay.
They didn't. So during the course of the night shift kept taunting him about why he was in jail.
Why was he in jail? Do you remember what they said specifically?
They said something about a theft or a robbery, I believe. And as we're talking, I remember them calling him Danny at one or two points during the conversation. They tried to personalize things.
Is Danny his first name?
I don't know if it's middle name or first name.
Okay, do you know Danny to be his name?
I don't know it. I never heard of the guy before in my life.
Okay, go ahead, sir.
Danny could have been anybody, I suppose, but they were talking to Danny, and they were talking to Mr. Lindenbauer, depending on their attitude. Most of the officers, well, there was a male and a female that were on duty last night mainly. were taunting him and teasing him and busting his tail a little bit. He kept getting more and more vocal about needing to get a pencil, needing to write something. He wanted to complain because nobody had taken him to see a judge. Nobody would let him have any access to anything. Nobody would let him see a nurse. He said he was having medical pains, and they just wouldn't do anything. Now, I know that the standard procedure at the jail is the nurse comes by around 9 o'clock in the morning and hands out medications and stuff, but they do have a nurse on duty, and apparently it wasn't serious enough to warrant calling the nurse at that point. He kept getting more and more agitated. He was, to the best of my knowledge, I heard them offer him breakfast this morning. I don't know if he took the tray or not. I believe he did, because normally if you don't take the tray, they'll say that you refused, and they did not say that he had refused. Whether he ate it or not, I have no way of knowing. And at that point, after breakfast was done, the shift changed at 6 o'clock, which is standard. The new shift came on and tried to be reasonable with the guy, and he kept insisting that he be allowed to fill out the inmate request form. He wanted to see the nurse, he needed to see the nurse, but he mainly wanted to fill out the request form. None of the officers would fill out the request form for him, like taking dictation like a secretary would, which might have resolved the problem or placated him a little bit. He kept getting more and more agitated as the morning went on. Somewhere around 8:30, I'm estimating, because I don't have a watch and I don't have a clock in my room. Somewhere around 8:30, could have been as late as 9 o'clock, he started getting more vocal and demanding to see the nurse, saying that he was having pain. At that point, the nurse did come by with an officer named McDade, and talked to Mr. Lindenauer and tried to calm him down. Said they were going to see what they could do, and they started walking away from him to my cell, because I get medication for blood pressure and all sorts of other stuff. So they were coming to me to take care of me.
Did you get any psychotropic drugs or anything like that, sir?
I get some sort of a pill for depression. Yes, but that's the only psychotropic anything I take.
How does that affect you?
It doesn't. I mean, it maybe relieves a little depression, but I've been taking it for 25 years.
The only reason why I asked is I wanted to make sure that the things that you heard or saw today were not under the influence of anything.
No, I was not under the influence of anything, and I'm not delusional. And
okay. I didn't. I'm just.
No, I understand.
Right. Go ahead, sir.
Oh, okay. So I'm going to call him Danny just for the heck of it. He kept complaining that he was in pain, he was hurting, and he needed to see the nurse. But the nurse came over to take care of me, and she had another 30 some odd people to have to see. And she'd said to one of the officers that they would get back to him when they got done making their rounds. And today being Tuesday, the doctor was supposed to be here, and I don't know if they would have gotten him down to see the doctor or not, but he was loud and obnoxious. Mr. McDade, when he had talked to him in a very different tone of voice.
Who's that, Mr.
McDade? He's an officer that escorts
McDade?
MC capital D-A-D-E.
D-A-D-E?
Yeah.
McDade?
He escorts the nurse. He works in medical, but he's a deputy sheriff. Okay. He had a whole different approach with Danny. He was nice and quiet and calm, and Danny actually did calm down for him substantially.
And what time was this, sir?
Right around 9 o'clock or so. I'm estimating, again, it could have been a tad earlier. It was right around the time I got my pills. But then McDade left. The nurse left Danny, and Danny started banging and kicking on the door. Loudly, very loudly. So much so that I could feel the door shake I could feel my door. I was sitting next to my door on my bed. I could feel my door vibrate from the force of the kicks that he was making next door. The nurse at that point said to put him in the chair, the restraint chair, which is at the other end of the officer's station. And a couple of the officers said no, they thought that he was going to calm down and they didn't want to have to go and do that. He kept banging and kicking on the door. I got my pills. At that point, one of the officers said, we're going to have to do him. And I assumed by that they meant that they were going to gas him.
Did he actually say specifically they were going to gas him?
Not at first.
Okay.
And they got to that pretty quickly, though.
Okay.
They then said that they told him to cuff up, to put his hands behind his back and come to the door and get handcuffed. He refused. He was in the back of his cell. From what he was yelling, that he was back there and he wasn't coming to the front of the cell because he didn't trust them. At that point...
Do you remember specifically what he said, Danny?
That I'm not coming to the fucking door. I want to sign the form. I want to fill out the form. I want a goddamn pencil. You motherfuckers aren't giving me a pencil. I can't write to anybody. I can't write about what I want. Everything is on camera. You're listening to everything I have to say. You're filming everything I have to say.
Does he ever encourage the officers to come in and engage him in a fight?
No, not that I didn't hear that. If he did, I didn't hear it.
Okay. I'm just asking.
Yeah, well, I'm just answering. So at that point, he's in the back, toward the back of his cell. He won't come forward. So one of the officers said, we're going to have to gas him. So one of the officers pulled out the canister of gas. I think they said it was black. I couldn't swear to it, but I heard the word black. And they sprayed him. They gave him one final warning to come forward, a direct order to come forward and get handcuffed. What did that order
sound like, sir, as you heard it?
This is a direct order. You are to come to the door, put your hands on the window ledge, and get cuffed up.
Do you know who said that?
No.
Do you know if it was an officer or an inmate?
Oh, it was an officer. It was a male officer.
Okay.
And it was a white male officer because there's a difference in their respective voices between the white males and the black males.
What happened next, sir?
They sprayed him with the gas. Well, what happened next was I reached over and grabbed a towel and put it over my face so that it wouldn't affect me. And they sprayed him with the gas. And there was silence in his room for about a minute. He stopped banging and kicking and threatening, but he didn't come to the door either. The officers opened up the door to his cell. I could hear the door being opened. Up until the point that they gassed him, I could see the officers outside because they'd left the hatch to my window open. But when they gassed him, they'd closed the thing right around that point. Just before they gassed him, they closed the window. They went into the room. I heard them talk about they were going in. I heard the lock open and the door creak open. I don't know how many officers went in, and they pulled him out of the room. They turned him around, and they handcuffed him behind his back. At that point, I heard them taking him out of the cell and down to the restraint chair. Once they got to the restraint chair, I could hear them sitting him down on the chair and putting the various belts on him. I could also hear him complaining because apparently, and I've never been restrained so I don't know, they put a hood over his head, some sort of a hood. Very shortly after they put the hood over his head, he started complaining that he couldn't.
How do you know they put a hood on his head?
Because he was complaining that he had a hood on his head.
Okay.
And he couldn't breathe. That he was having chest pains. He couldn't breathe.
You remember specifically what he said?
I can't breathe. I can't breathe. Get this hood off. I'm going to behave. I'm going to behave. Don't worry about me anymore. I'm sorry I acted up. I'll do anything. I'll sign anything. Just let me get some air. I have to be able to breathe. He was talking about having chest pains, severe chest pains. Please get the hood off me. I'm not getting enough air.
What happened next?
The officers said no, that they were going to leave the hood on him. And the nurse was going on around about her duties to deal with other inmates, because I could hear the hatches on other cells opening and closing as she went about her duties. I'm estimating about 10 to 15 minutes later, I heard this whooping noise, which I'd never heard before. And that was from the defibrillator device, whatever, the heart device.
Finish real quick. Go ahead, Mr. Barsaw.
They were using the heart device on him. And they're not having, it didn't sound like they were having a great deal of success. At that point, they decided to call an ambulance and take him to the hospital, which they did. And then the officers started trying to reconstruct exactly what happened and how it happened so they could write their reports.
What conversations, if anything, between the officers did you hear?
They were mainly trying to coordinate time frames of what happened in what order chronologically, and exactly which officer did what. There was confusion, as there often is in cases like this, of exactly who was standing where and who did what, because everybody was responding in a different way to the emergency that had arisen. So what they were doing was basically just trying to make sure that they had recollected accurately so that they'd be able to write all of their various reports.
Can you think of anything else, Mr. Farr?
No, except for the fact that before they did the heart device, he had been speaking for a good 10 or 15 minutes, maybe longer, about how he would comply with everything that they said, and he would go back to his cell and be good and calm and all that sort of thing. But they wouldn't remove him. Oh, and they did send a trustee during that 15-20 minute period. They did send a trustee in to mop out his the floor in his cell and to change the blanket and all that sort of thing. They did that in hopeful anticipation of putting him back in the cell, but that apparently didn't happen. That's about it.
Mr. Farr, thank you very much for coming forward and being honest with you. We appreciate it. Do you have any questions for us?
No.
All right, this concludes the interview. This is Agent Greg Holycross of the Florida Department of Law Enforcement. The date is March 12th, 2013. The time is 5:49 p.m. I'm conducting the interview with Scott Moody, a paramedic on Engine 20 at the Clay County Fire Rescue. It's located in Green Cove Springs at 303 South Oak Ridge. Mr. Moody, I want to place you under oath. This is going to be a sworn, tape recorded interview, so if you will, please raise your right hand. Do you swear or affirm that the statement you're about to give will be the truth, the whole truth, and nothing but the truth?
I do.
Okay. How long have you been a paramedic, sir?
Paramedic.
Or working for the
Working
Clay
at the county
Rescue?
as a paramedic. It's probably been going on 5 or 6 months now. I ain't got the exact date.
Okay. And today you were riding on Engine 20 as a paramedic. Is that correct?
Yes, sir.
And you got called or dispatched to a
call at the Clay County Sheriff's Office. Is that correct?
Yes, sir.
Do you recall about what time that was, roughly?
Oh, this morning around about 9:15 or so.
Okay. And do you recall what the call initially was?
Came out as a cardiac red.
Which means that you have someone that's in a cardiac arrest.
Cardiac
or
arrest.
Cardiac. Okay. All right. And on engine 20 with you was who was riding with you also?
I had Lieutenant Phil Crider, and he's a medic as well. And we had firefighter Matthew Hoff, who is also a paramedic.
Okay. H-U-F-F? Huff?
Hoff. Oh,
H-O-F?
H-O-F-F.
Okay. Thank you. All right. Once you got to the Clay County Sheriff's Office, just give me just a little story of what exactly you saw, where you went, what you did.
Initially, we walked in, and in the I guess the center location of outside the cells, there were a group of people. Like there was a nurse and a couple other people that were performing CPR. Someone doing chest compressions, and one as well using BVM, giving rescue breaths to the young adult male.
Okay, he was laying on the floor?
He was laying supine on the floor. He was completely naked, and CPR was being performed.
And this was not inside of a cell, this was
outside in the opening.
Kind of at the foot of the stairs?
At the foot of the stairs in front of the where they sit. Yes,
observation deck or whatever?
Mm-hmm.
Okay. Okay. And they were the medical people or corrections officers from the Clay County Sheriff's Office were doing CPR and bagging him. Is that correct?
Yes, sir.
Then what did your team do then at that point?
First, we hooked him up. They had them on. He was placed on the AED, the defibrillator there, the gel, and we switched all the equipment over to ours so we could use our equipment. And then we took over CPR. We had one guy get IV access, and then I intubated with a King tube so we could get a more advanced airway.
Okay, so you intubated him. You put him on your monitor.
On our monitor, hooked him up to our defibrillator.
Okay.
He was not in a shockable rhythm, so we kept on with CPR and then started doing used IV therapy, giving epinephrine, and we did a couple rounds of that, and then we were doing that. Not much activity was going on, and then we about rescue 15 before transport showed up a little bit after that.
Okay. Do you recall any of the corrections officers telling you basically what happened? How he arrived at where he was, or what precipitated?
I didn't hear everything that was going on with everything going on, so the only thing that I really heard of that he was in a restraint chair for maybe up to an hour, and I had heard someone say that they had just talked to him, or he was talking 10 minutes ago, and then that's when they noticed that he was unresponsive.
So approximately 10 minutes had gone by, and they didn't hear him or see any activity, and then they checked him. And
I heard someone say.
Okay.
I'm not sure who said that.
All right. Did anybody say anything about him getting pepper sprayed or anything like that?
I didn't hear that until my lieutenant told me that afterwards. I just heard he had been aggressive, and that's why he was put in the restraint chair, that he was banging his head.
Aggressive. Okay, that was just my next thing. He, inside his cell, the corrections officer said he was aggressive, banging his head.
That's what I was told.
Okay. When you examined him at the time there, you didn't see any open wounds or bleeding or any cuts or anything on his head?
No, sir.
At the
I didn't
time,
see any
right?
kind of trauma of any kind.
Okay. All right. The time that you were there, did he ever regain a viable heart
Nah, he was
rate at
never
all?
responsive. He might have had a little bit of PEA, which is just a little bit of the heart acting, electrical activity on its own, but nothing substantial.
Okay. And then after Rescue 15 got there, since you guys were initially doing that, continued for just a short time after that, and then they transported him to Orange
We
Park Medical
continued
Center.
probably for another few more minutes, up maybe 5 or so minutes. Pushed a couple more, gave him a couple more drugs. I know we did Epi, we used that a couple times. We used some Narcan and some sodium bicarb, and pretty much he stayed the same the whole way. He might have been showing a little beat, but it was PEA. He had no pulse, and that was the only kind of activity.
Okay. So he never regained any viable
No, sir.
heartbeat, never said anything, had any consciousness at all while you were there?
No, sir.
Okay. Anything else you can think to add that I didn't ask you a question about?
No, sir. I think that's pretty much covers it.
Okay. Time is now 5:57. I'll terminate this interview.
The date is March 12, 2013. The time is 12:23 p.m. We're at the Clay County Sheriff's Office, County Jail, and we're interviewing Neil McDade. My name is Special Agent Tom Mays with the Florida Department of Law Enforcement. Okay, Mr. McDade, if you could spell your name for the record.
Neil, Neal,
Your last name?
McDade, Mcdade.
Okay. Now I'm here to interview you concerning the incident with an inmate this morning. Right now I'm going to swear you in for the interview today. Do you swear that the facts that you're to give are the truth, nothing but the truth?
Yes, sir.
Okay. Okay, this is involving an incident with inmate Daniel Joseph Linsenbigler. So if you could just tell me in your own words what you remember about the incident or incidents this morning.
Yes, sir. I went upstairs to assist with the nurse to pass meds in confinement. I don't know at the exact time. Got to Linsenbigler's door, and he was very agitated, and was just talking to me about wanting to see the doctor, and some of the things he was saying weren't making a whole lot of sense, but he was doing a lot of yelling and cursing. And basically, the nurse and I talked to him and said, we're going to try to get you to see the doctor, because the doctor was coming in this morning to see patients.
Right. You don't know what time this was this morning, or
this was approximately, I would say probably 8:30 approximation.
Okay.
So basically I said, just hang in there. Let me see what's going on. See if I can get you to see the doctor. The nurse and I were kind of both on hand on that one. And we shut the door, closed the flap, and continued to pass our meds in confinement. At that time, when I closed the flap, he became agitated. Now, I don't have my eyes on him anymore because the flap is closed, but he became agitated enough that he was banging the door very hard, enough where if you're on the side looking down the doorway, the door was actually moving outward.
Okay.
So the force was definitely extreme.
And you don't know what he was using to bang that with?
I don't know.
Okay.
He only had, he was on suicide watch, so all he had was a suicide smock and maybe a Bible in his room. So I'm guessing it was his body.
Okay.
But I don't know what part of the body. And at that time, with the force he was using, the nurse and I, more the nurse said, we need to probably try to get him out of the cell. So that was when they called the supervisor upstairs. Sergeant Heaps came up, and called in other deputies.
Right.
Do you want to know the deputies on hand, if I remember them that were in there? Or?
No, that's fine. We'll find those out.
Okay.
They have a list.
Okay. And I went ahead and continued until the supervisor got there, because that's kind of standard procedure, until the supervisor gets there, unless it's an extreme need to get him out.
Right.
And then you have 2 officers there to get him out. But
Right.
we waited on the supervisor to get there, and the nurse, Glenn, and I continued to pass meds down the row.
Right.
Supervisor came in, a couple other deputies came in, and I don't know exactly what they were talking about at the time, because I was about 7-8 doors away. I was just assuming they were planning a cell extraction per se to get him out of there,
right.
so he didn't harm himself.
Right.
So they're all gloved up, and I don't know the exact plan that they had in place, because I was with the nurse, not really part of that little group that was initially going to go into the room. But I kind of gathered that they were definitely going in, so I started to mosey on back, got my gloves on, and by the time I got to the room, they were already opening and entering the door.
Mm-hmm.
I don't know, I think he was very active. I was the 4th one deep, 4th one in, so he was very active. I don't know if he was swinging or stuff like that, but he was extremely agitated and active. Somebody sprayed him. I don't know who sprayed him.
Okay.
And then we grabbed a hold of him and took him out of the room. We got him out of the room and into the chair.
Okay. Is that normal policy?
Once you get him out, yeah.
To spray them and then you pull them out and you extract them?
You could do different types of things. I mean, you could, depending on the matrix, the use of force matrix, and what you should do in that situation, whether tasing or spraying or just hands-on. But I'm just guessing. I didn't exactly see him because I'm bad in the back. I don't know exactly what physical force he was coming at us with. But I was just assuming that it was pretty active, the way he was acting before.
Mm-hmm.
So So thing is, you get him out of the cell, we put him into the chair, and we restrain him.
Right.
The part I had in that was I had the right arm. I had that part restraining him, and also assisted in the straps that go over the chest and that connect to the back of the restraint chair.
Okay.
So those were my parts in the actual restraining. At that time, a lot of saliva was coming out of his mouth. So obviously, due to just the spray and stuff like that.
Right.
And he was not necessarily actively spitting, but it was definitely saliva was flying out in the direction of other people that were tying him up. And,
whether it was intended or not.
Yeah, getting him secured into the restraint chair. So intended or not, I don't know. But he definitely had spit coming out. So we the spit mask was brought over, and it was placed on his head, and the securing of the inmate was complete in the chair. He's in the chair. We continue to pass meds, just let everybody kind of regroup. He's still yelling, cursing, uncontrollable, verbally.
Right.
So Nurse Glenn and I continue to pass meds. We finish our med pass, and we exit confinement.
Is that something that's normal to put him in that chair and let him calm down and all that?
They calm down, and then once they calm down, you decontaminate them at soon as practical time.
Right.
To let him get all the stuff out of his face and wherever it's on his body. I don't know at what part of the process they were going with on that decontamination and getting him out of the chair, because I left the room.
Okay.
When I did leave the room, he definitely was calming, but still verbally agitated.
Okay. How long after? You said it was around 8:30. How long do you think that all took place?
We were probably out of confinement from the time we put him in the chair, we were probably out of confinement within, not exact, but probably 10 to 15 minutes.
Okay. Now the incident, that was from the start of the incident in the cell?
The first one.
Okay. So that's all, it was just about 10, okay. Yeah, somewhere around there.
10 to 15, maybe closer to 15, but I don't want to.
No, that's fine, it's just whatever you remember.
You want me to continue on with?
Yeah, you said you left confinement 10, 15 minutes, something like that. And then, yes, when were you called back? When did you arrive back in the...
We went downstairs to do the vital signs and get ready for the doctor that comes in on Tuesdays and Thursdays. So we're in the middle of doing all that stuff downstairs when they called over the radio that the nurse needed to be back to confinement because, obviously you could hear it in their voice. There was definitely a problem, and it was urgent.
And that was about how long? Or what, do you remember?
From when we left confinement to when we came back was maybe another 15 minutes.
Yeah,
maybe.
so not long. And then she got the call, and that's when you guys went back.
They called over the radio. They called for the nurse to be 51 to confinement, and for the sergeant to be 51 to the confinement, lieutenant.
Right.
And basically, that's when everybody came to confinement,
right,
along with more people than we originally had for the extraction.
Right.
So now we're double the people.
Okay.
So, yeah, we get back to confinement approximately 15 minutes later. And I don't know exactly when we entered who was already trying to get him out of the restraint chair, but there was 2 or 3 deputies already trying to get him out of the restraint chair. The nurse and I went straight over to the restraint chair to assist them in getting him out because he was unresponsive.
Okay.
My visual on it was his head was just kind of leaning back, like to the side, like tilted back to the side like that. And he didn't look like he was, I don't have a whole lot of history in that, but he didn't look like he was breathing.
Right.
So we're getting him out of their chair as soon as possible. I assist in unhooking him. I don't even know if you need all this, but I unhooked his waist strap, helped unhook the chest strap.
And who started performing? Did you get him out of the chair? Who did you start performing CPR?
No. At that time, there was probably 8 of us in there now. And Nurse Spinell went and got the AED, and Nurse Glenn started the CPR. She started on the chest contractions, and Nurse Glenn started on the chest, and I believe Nickel had the pump, the breathing,
right,
for the two breaths after every all 30 contractions. So Spinell was on the AED, Nurse Glenn was on the chest contractions, and Nickel, I believe, was on the pump with the facial mask.
Okay.
I don't know if Nurse Spinell totally put on the patches from the AD, or if that was Nurse Glenn and somebody took over for her while she put the patches on. But the patches were applied to Winston Bigler's chest and side, and they continued to cycle out the contractions and listen to the instructions given by the AED machine. Nurse Glenn was doing the contractions, and then when she got tired, Deputy Magella started doing the contractions, and Nickel held when it was time to do the breaths, held the mask to his nose and his mouth, while Deputy Acosta did the pumps. So now Magella's on the contractions, and they're on the breathing.
Okay. And how long do you think?
Rescue was before. I'm sorry.
No, go ahead.
Rescue was actually Nurse Glenn, I believe, told Deputy Wolf, which was the control room officer, to call rescue, call 911. And that was before, that was actually, as we were laying him down on the ground in a chair, she told her to, I'm pretty sure it was Deputy Wolf, to call 911 rescue. And so I'm
okay.
I don't know if you need to know that process and who she contacted for that, but at no point was I was just kind of waiting for if I needed to jump in or something.
Right.
There was so many of us that, I was kind of in back of Nickel,
right,
the one that was on the facial mask. So just kind of waiting and seeing how I could assist.
Okay.
And then the major told me to leave confinement to go down to get the transfer summary and all our medical stuff that goes with the inmate to the hospital once he gets picked up.
Okay.
And I never came back.
Okay. Did you pass that off to somebody? Or?
Well, I wasn't really doing anything at the time, so it was kind of, me passing it on was basically just the other people that were
No, I meant the stuff, the information that you were go get.
Yes,
okay.
right. We typically, handcuffs and leg irons, we always send that to the hospital just in case they need transfer summary, a face sheet, a log.
Right.
Just the regular stuff we send with them to the hospital.
Okay. Is there anything else that you can remember? That's it? That's all your portion of it?
Yes, I believe that's all I can remember at this time.
Okay. Now, your title here?
Medical officer.
It's a medical officer. And you've been a medical officer for how long?
Approaching 1 year.
And how long have you been total with Clay County?
Just over 4 years.
Okay. Now, how many interactions have you had with this prisoner before? I don't know how long he was here. Do you remember interactions with him previous and how he acted?
He's always acted. I've had a couple interactions. One, he saw our doctor last week.
Okay.
And I'm always there with in between the doctor and the inmate. So he saw the doctor once. I had an interaction there. Not a whole lot of verbal between me and him.
Right.
But and then we brought him down for a medical assessment, which the nursing staff does it on the inmate before they're here for 14 days. We have to get that done.
Right.
A medical assessment, just a bunch of medical questions and a TB shot.
Okay.
The standard stuff. So I had 2 interactions with him. He was definitely. Something was not exactly right with him.
Okay.
I don't. What that is, I don't know. I don't want to necessarily lay total judgment on him, but
I was saying he was acting not right or talking not right.
He was just. It was more, honestly, from him. It was more expressions that I noticed. Where I was like, because on our assessment, I was like, "Hey, you all right?"
Right.
And, just his expressions. I think he had told the doctor that he did some drugs, and I believe one of those drugs was. I don't want to be 100% sure. I think one of the drugs was K2.
Okay.
And I don't know a whole lot about that, but I've heard that can kind of throw you off a little bit.
Okay. Well, let me get, as you stated before, let me go ahead and get a rundown of the people that you remember that were there.
First time or when he got called back in?
Both.
Okay. The first time when we went in and took him out of the cell, it was Captain Wall, Sergeant Heaps, Deputy Holtzen.
Holtzen?
Yes.
Okay.
Houlds. Deputy Costa. Deputy Bloodsworth. Deputy Wolf was in the control room.
Okay.
And I think that was it for the initial response. And then
Okay.
obviously Nurse Glenn. She was,
With you.
yes, sir.
Is it Glenn, like G-L?
Glenn.
Okay. And then when you went back, who do you remember? Just who was, trying to get him out of the chair. Don't need to.
Out of the chair was, I believe it was Center.
Deputy
Centers.
Okay.
Center or Centers? I think it's Centers.
Okay.
Deputy Bloodsworth. Deputy. I hate throwing names out there when I'm.
No, it's fine. Just whatever you remember.
I'll say I'll think.
Okay.
If that's good enough. I think Nickel was there. Acosta was there. Holson was there. I think they all had part of kind of getting him out of the chair and onto the ground where we could start performing.
Right. And then you said the nurses were...
Both nurses were there. Nurse Glenn and Nurse Spinell were there at that time.
Okay.
And then, you had other people in there too.
Yeah.
But they came in.
Okay.
They started filing in as it was going on.
Okay. Okay, is there anything else that you can think of?
Not that I can think of, no, sir.
Okay. All right, this is the end of the interview. It is approximately 12:45.
Okay, today is the 15th of March 2013. It's approximately 10:45 a.m. My name is Special Agent Rusty Rogers. I'm with the Florida Department of Law Enforcement. This interview, I'm conducting a criminal investigation. This interview is being conducted at the Clay County Sheriff's Office in the detention facility. And today I'm interviewing
Becky Wolf.
She's a detention deputy with the Clay County Sheriff's Office, and also Detective Wes Smith from Clay County Sheriff's Office is present during the interview. Before I get started, I would like to confirm that this statement is a voluntary statement, that no one has threatened you, coerced you, or induced you to give this statement. Is that correct?
Yes, sir.
Let's talk for a minute about your Garrity. We talked about it offline. Now we're going to talk about it online, so you have a complete understanding of it. Has anyone from your agency commanded you to participate in this interview?
No, sir.
You should understand that this is a criminal investigation, independent of any departmental administrative inquiry. Your participation in this interview is completely voluntary. You do not have to participate, and there can be no repercussions by your agency if you do participate. Do you understand that your agency cannot compel you to participate in this interview, and that your participation is strictly voluntary?
Yes, sir.
Having that in mind, do you agree to give a voluntary statement at this time?
Yes, sir.
Do you understand this interview is being tape recorded?
Yes, sir.
Do you have any objection to it being tape recorded?
No, sir.
Okay. At this time, I'd like to place you under oath. This will be a sworn tape recorded interview taken by a law enforcement officer pursuant to Florida State Statute 117.10. Please raise your right hand. Do you solemnly swear to tell the truth, the whole truth, and nothing but the truth?
Yes, sir.
Okay. Would you please state your name for the record
Becky Wolf,
and your date of birth?
5/11/87.
And please state your current address. Nope. I'm sorry. We're not going to use your address. We're going to Clay County Sheriff's Office is where you're employed. And what's your current occupation?
Detention deputy.
Okay. And please give me just a brief indication of what your educational background is.
For the sheriff's office,
Just in general.
I graduated high school.
Okay.
Actually, start college here coming up. I've done a little bit of college.
Okay.
Not much.
Okay. And then you went to?
The police academy.
Right.
So I started the end of 2009, September, and I finished January 2010.
Okay. Are you dual certified?
No, sir.
Okay. You correction certified?
Yes, sir.
Okay. Today we're here to take a second statement from you. This statement is at my request, in that we need some clarity on some issues that were not brought out in the first one. Do you have any objection to being interviewed a second time?
No, sir.
Okay. Do you understand it's for the good of the investigation?
Yes, sir.
Okay. In your own words, just tell us basically what happened. You don't have to be as precise as you were in the original statement, because this statement that we're taking today and the statement you originally gave us will combine together, will be your statement.
Okay.
Are you okay with that?
Yes, sir.
Okay.
So you want from the beginning of my
Well,
day,
just
or?
whatever you think is important. Specifically, let's go back and talk. We talked about a few things before we turned on the tape recorder. Is that correct?
Yes, sir.
We discussed your log and your log entries inside the pod that you do the observation.
Yes, sir.
Okay. You mentioned to us that you, after the incident occurred, and after the subject had been taken out of his cell, had been placed in the tie-down chair, and had the spit mask placed on him. Do you know who put the spit mask on him?
I did not see who actually put the mask on him.
Was the spit mask on him when he was rolled around to where your desk was at?
Yes, sir.
Did you ever see them take and put him back into the cell?
No, sir.
Okay, because the reason why I asked that is initially they were going to put him back into the cell, and the contamination from the CS spray was too great, and they pulled him right back out. It was
Yes,
less
sir.
than a minute. Just
He never, I don't even think he actually went in. I
Okay.
think they got him to the door and they said it's basically too strong, and they rolled him back out.
Okay, now his position is next to the control desk where you're at. Is
Yes,
that
sir.
correct?
To the right.
To the right. Could you see him?
Yes, sir.
Okay, when you did your checks that you indicated on your log, would that be a visual check, or did you get up and actually walk over to where he was at, or just explain to me how that happened?
I visually looked at him and got up and walked over so I could physically be within close proximity of him to see what he was doing.
What kind of things are you checking for?
To make sure he's breathing, if he's moving, if he's talking, yelling. I look to see if their chest is moving, stuff like that.
Okay. Do you normally make note of what they're saying when they're yelling?
When they're yelling, I don't usually make note of it. I'll usually just put on there that they were yelling. He was yelling. I can't really make out or tell you what he was saying.
Okay. You made notations in your log that on a couple different occasions during the observation period that he was yelling.
Yes.
Do you, at this time, remember anything at all that he may have been saying?
I don't really. I remember he said one time that I actually heard while I was in there that he wanted out of the chair, which is normal for people who are in the chair. But other than that, I don't remember anything that he was saying. It was
Okay.
a lot of screaming, yelling.
Now, at some point, you told us when we were talking off the record and we were just having a conversation that you felt it necessary for you to leave
Yes, sir.
the observation pod and get relief from the observation pod. Explain to me how that happened and why you left.
I got relief because he had just gotten sprayed previously, and I was going out to get some fresh air from all the spray, and I was relieved by Deputy Center, who basically takes my place while I leave because it's mandatory that someone's there at all times.
Tell me what you're experiencing as far as the spray. Now, he's pretty close to your desk, is that correct?
Yes.
Okay. It's just 3 or 4 steps up, and you're in the pod, and if you were to go down and check on him, it's just like 2 or 3 steps down, and he's immediately to your right. Is that
Yes.
correct? Okay. So the pictures we showed were accurate, right?
Correct.
Okay. Tell me what side effects or what type of effects were you feeling as a result of the spray?
Mine was just sneezing.
Okay.
I tend to have awful allergies anyways, and anytime I get in any proximity of it, it happens. So I just asked for some relief so I could go outside and get some fresh air to try to clear it up.
Could you smell it?
I couldn't smell it in there, but and I don't know if that was because I was already in there, and it's one of those, you get kind of used to the actual smell of something, you leave and come back. But when I came back, I didn't smell it.
The sneezing that you said you experienced, would you say it was a direct result of the chemical spray?
Probably. I wasn't doing it beforehand. So, I mean, actually, I don't know. I can say yes, but
Well, what do you think?
I'd,
I mean, you're the one sneezing, it's your body.
Yeah.
What do you say?
I'd probably say yes.
Okay. All right. Now, my understanding is based on our conversation a few minutes ago, and we reviewed the log together, that, can you tell me what time you left?
I believe it was 8:26.
8:26. I'm showing you a copy of the log. So, looking at that log and the entries that you made, what time would you have left for relief?
8:26.
And who relieved you?
Deputy Center.
Okay, so at 8:26, Deputy Center would have relieved you?
Yes, sir.
Okay, tell me what happened next based on your log. What time did you return?
8:52.
8:52. So you were gone roughly what?
About
How many minutes?
25, somewhere in there.
Okay, 25.
25 minutes.
Okay. And what's the last thing you observed at 8:26?
At 8:26, he was yelling.
He was yelling. So the subject was still alive.
Yes, sir.
Okay. But you don't know what he was yelling, but you obviously know he was yelling.
Yes, sir.
Okay. At 8:52, when you returned, did you check him again?
I walked right past him to get to where I was going, and he was moving. He was sitting in the chair, and he was moving.
Was he yelling?
He wasn't yelling.
Did he seem to have trouble breathing?
He didn't seem to have trouble breathing.
So it would be safe to assume at 8:52 he was alive.
Yes, sir.
Okay. At 8:56, you look at him again, 4 minutes later.
Yes, sir.
Is he still moving and still alive?
Yes, sir.
Okay.
Still moving.
At what point, based on your log and your observations that you recorded, did you notice that he was not moving?
At 9:06.
And at 9:06, you sounded the alarm and said somebody needs to check him?
Yes, sir.
And who did you initiate that with?
Deputy Center.
Did Deputy Center go over and check him?
Yes, he did.
What happened next?
Deputy Center went over and checked him. He pulled off his mask. Immediately knew he wasn't breathing. Felt for a pulse.
Did you actually see him pull the mask off?
Yes.
What type of coloration in the face and stuff like that did you notice? Any
None. Gray.
gray? Did it appear to you that he wasn't breathing, based on what you observed?
Yes.
What happened next?
He was checking for a pulse, and I was immediately on the phone with the nurse.
Okay.
When he said he didn't have a pulse, the nurse was already on her way.
Who did you get a hold of?
Nurse Glenn.
Nurse Glenn. Did she respond?
Yes, she did. Her and Nurse Spinell responded.
Her and who else?
Nurse Spinell.
Spinell?
Yes,
Okay.
sir. He started unhooking all the stuff to get him out of the chair. I had called over the radio for any available officers need to immediately be in confinement. Deputy Nickel was actually the first one to respond, who assisted Deputy Center with getting all the stuff up. By that time, Deputy McNaid and the two nurses were coming in. They took him out of the chair and got him on the floor and started with CPR.
Okay. Were you involved in any type of emergency medical care for him?
No, sir.
Okay. You maintained surveillance over the other cells inside the pod. Is that correct?
Yes, sir.
Okay. What, if anything else, did you see that day that happened that you think is a point of interest that we need to know about?
Nothing that I can think of. Between this one and the last one, I think I've covered it all.
Okay. Do you have any questions for us?
No, sir.
Okay, this concludes the interview of Deputy Becky Wolf. Okay, today is the 15th of March, 2013. It's approximately 9:50 a.m. I am Special Agent Rusty Rogers of the Florida Department of Law Enforcement. I'm a law enforcement officer conducting a criminal investigation. I'm interviewing Clay County Sheriff's Office Sergeant Robert William Heaps, Heaps. Date of birth is 5/29/1960. Present during the interview also is
Detective Wes Smith.
Wes Smith from Clay County Sheriff's Office. And before we get started, I'd like to confirm that this statement is a voluntary statement, that no one has threatened you, coerced you, or induced you to give this statement. Is that correct?
Yes.
Yes. Okay. I want to go through what they call a garrity cleansing. We explained it to you off tape, but I want to be sure to do it again on tape so you understand. Has anyone from your agency commanded you to participate in this interview?
No.
Do you understand that this is a criminal investigation independent of any departmental administrative inquiry? Your participation in the interview is completely voluntary. You do not have to participate, and that you cannot be in your agency provide administrative repercussions if you refuse to participate. Do you understand that your agency cannot compel you to participate in this interview and that your participation is voluntary?
Yes.
Okay, having that in mind, do you agree to this voluntary participation in this interview?
Yes.
Are you aware this interview is being tape recorded?
Yes.
Do you have any objection to it being tape recorded?
No.
At this time, I'd like to place you under oath. This will be a sworn tape recorded interview taken by a law enforcement officer pursuant to Florida State Statute 117.10. Please raise your right hand. Do you swear and affirm that the statement you're about to give will be the truth, the whole truth, and nothing but the truth?
Yes.
Okay. Please state your full name and date of birth.
Robert William Heaps, May 29th, 1960.
Please state your current occupation, your employer.
Detention Sergeant, Clay County Sheriff's Office.
Okay, and please just basically give me a synopsis of your educational background.
Associate's degree and a bachelor's degree of arts.
Okay. We're here today to take a second statement from you, or I'm going to refer to it as a supplement to your first statement. You can say anything that you want to say. You're not limited by your first statement as to what you participate and say in the second statement. Do you understand that?
Yes.
Okay. Do you understand that anything that's in the first statement will also be in addition to what you provide today?
Yes.
In other words, you take the first statement and the supplemental statement you provide today, place them together, and that would be your statement.
Yes.
Okay, are you okay with that?
Yes.
You understand that?
Yes.
Okay, and once again, you're not compelled to give a statement today, is that correct?
That's correct.
Okay. In your own words, just tell us what your concerns are. And you contacted me and asked that I come back in, and you had a few things that you had forgotten originally,
Right.
and you wanted to clarify, is that correct?
That's correct.
Okay. In your own words, Sarge, just tell me what your concerns are, and tell me what your corrections are, as best you can recall,
Okay.
and we'll go from there.
Like I told you yesterday on the phone, there was a few things that I started recalling that I didn't bring up during our initial interview. So the first thing was when I was first called to confinement, I spoke to Nurse Glenn, and she had told me that the inmate that we were dealing with was schizophrenic. I didn't mention that to you, so I just wanted you to know that. She had mentioned that to me.
And she's the staff nurse that was on duty at the time?
Yeah, she was on duty at the time. The other thing was
And her name is Glenn?
Nurse Glenn.
Okay.
The other thing was right after the inmate was, we had him restrained in the restraint chair. He was making a ruckus, so I was going to have him put back into his original cell, but the guys wheeled him in there in the restraint chair, and they said, told me, Sarge, there's still way too much residual in here, so we wheeled him back out.
Okay.
I had forgotten to tell you that.
Okay, well, I'm going to stop you and just ask for a little bit of clarification. When you say residual, are you referring to the OC spray that was initiated?
Yeah, some OC spray was still in the air enough to,
So you took him in the room. How long would you say he was in the room?
It wasn't real long. I couldn't give you exact time.
Less than a minute?
Probably.
And then you took him right back out?
Yeah.
And where did you guys place him at that point?
At that point, we placed him over by the observation booth where the two officers will be sitting.
That's
in
the
middle
control
of
panel area or in the center of the pod?
Right over there by the control area and in front of the stairs, on the edge of the stairs.
Okay. Because I wasn't there, for my information, so I can better understand and kind of get a visual picture as to what's going on. He's now restrained in the chair?
Yes, sir.
Is the spit mask on his face or not?
I don't know if it's on there yet or not.
Do you remember at what point and who put the spit mask on him?
I don't know who put it on.
Okay.
I really don't.
Do you remember at what point it was put on? Let me just ask you this way.
I don't know
Were
the
you-
exact
Were you
point.
present when it was put on?
I was in confinement.
Were you present there to see anybody put it on?
I wasn't. No, I didn't see him put it on. I didn't see it. So I was present, but I didn't. I'm probably.
But you weren't present enough
diverted.
to see. You didn't
Yeah,
see
I was
him put it
diverted
on.
or whatever. My attention was
Do
diverted.
you know whose decision it was to put on?
That I don't.
Was it your decision to put the spit mask on?
No.
Okay. Is he dressed? And I'm not familiar with this because I've seen it for the first time. What they call a turtle suit, which is a quilted suit that's put on him for his own protection. Is he in the strap-down chair with the turtle suit on, or is he nude?
he had his suicide smock on.
Which is what I
It
refer
was
to
a
as a
green
turtle.
suit.
I call it a turtle suit. Right?
Okay, yeah,
Okay.
yeah, he had that on.
So just for the record, let's call it the turtle suit. Because
Okay.
that's what I've been told it's called.
Okay,
And it's because it's green and it's the smock that they wear for their own protection, right?
yes,
Okay. That was one thing I had a question about.
okay.
Okay, what else? I didn't mean to interrupt.
And the other point was, before I left confinement, he had made a statement, I'm going to go to the bathroom in the chair. And he urinated in the chair. That was the other thing.
Okay, did you actually see him urinate, or did you leave
Yeah.
and he urinated with him?
No, while I was there.
Okay. Did you think, in your opinion, was he urinating as a result of his bad attitude and the reason why things had kicked off, or do you think he was in some type of medical distress and that caused him to go to the bathroom?
No, I mean he made the statement, said I'm gonna go to the bathroom in the chair.
Okay.
So he didn't seem to be in any distress. I think he just had to go to the bathroom
Okay.
at that point.
Okay. What else?
That was it.
That's it. Do you ever recall him making any other statements other than the statement that he was going to go to the bathroom in the chair?
Just the ones I already told you.
Okay. No other statements then? Okay. Were you there the whole time he was in the tie-down chair?
No,
You resumed your other duties, right?
that's correct.
The total time that he's in the tie-down chair, how much time together would you say you actually observed him in the chair? And what was his conduct when you observed him in the chair, the tie-down chair?
Conduct while he was in the chair, he was yelling and just making a little bit of a ruckus.
If you can remember, I certainly don't want to put anything out there. When you say he was yelling, do you remember what he was yelling? What he was saying?
No, I don't.
Okay.
I mean, not particulars.
So if he had yelled a particular statement or something like that, you wouldn't recall that?
I mean, I can't think of anything in particular. I mean, he was just mad about the whole situation in general.
Through your investigation as a supervisor on that floor, did you ever determine what caused him to become agitated in the beginning?
When they called me up there, Deputy Bloodsworth said that he was agitated because he wanted to use a pencil, which in his situation he's not allowed to do that unless he's directly supervised.
What would he want to use the pencil for?
I don't know. He had a Bible in there, didn't have anything else. I don't know what he was going to use it for. So he felt it is, in the inmate's best interest to not let him use it.
Is it a standard practice that they not be allowed to have a pencil?
If they're on a suicide watch, they.
Okay, let me narrow it down. Not they as a group, but this particular inmate, this particular person we're talking about, Lincoln Bigler.
Right.
Was he allowed to have a pencil?
I mean, it could have been under direct supervision. He could have used a pencil.
So if he filled out a request form,
Right.
because we found a request form inside the cell,
Right.
it appears to be somebody's writing. It appears to be his writing,
Right.
and we deducted that because where it says time, the person who filled out that form said don't know,
Right.
whereas you would know, or I would know if I worked here, but an inmate probably wouldn't know. And the verbiage that's contained on that same form seems to be a little bit rough and erratic, which and that was for a request for a Bible, and apparently it was given to him. But it looked like it was filled out by him. Is my point.
I think he had a little handheld one.
Okay. Do you know? I think I may have asked you. Were you aware now, or have you ever been aware of the reason why he wanted the pencil? Did anybody ever tell you?
No.
Okay. Anything else?
No, sir.
Detective Smith, anything else?
Now you clear the ruckus. That was one thing I wanted to ask that you hit on.
Okay. Now the ruckus. Let's talk about the ruckus for just a minute. I don't think we talked about it much before, but the ruckus. He was creating noise, banging on the cell, and these types of things, right? Did he ever make any overt actions toward you or any of your officers in an attack mode, or was he just raising sand?
he raised a bunch of sand, and then I didn't ever see him try to attack anybody.
Did you ever try to spit on anybody? I think we talked about that before.
I
Did
didn't
you ever
see him. I didn't see him try to spit on anybody.
And that's all I really want you to tell me is what you know, not what you think, or because I'm not going to ask you to give me testimony as to what everybody else was doing. That's not fair. Okay. Anything else? Okay. It's about 10 o'clock, and that concludes the interview. Okay. Today is the 12th of March, 2013. It's approximately 3:20 p.m. I am Special Agent Rusty Rogers of the Florida Department of Law Enforcement, and I'm conducting a criminal investigation. The interview is being conducted at the Clay County Detention Facility in Green Cove Springs, Florida. I'm interviewing Captain Thomas Howard Wall, and also present during the interview is Detective Thomas Barnes from Clay County SO. Before we get started, I'd like to confirm that this statement is a voluntary statement and that no one has threatened you, coerced you, or induced you to give a statement. Is that correct?
That's correct.
Part of the Garrity cleansing, or all of the Garrity cleansing, has anyone from your agency commanded you to participate in this interview?
No.
You should understand that this is a criminal investigation independent of any departmental administrative inquiry. Your participation in the interview is completely voluntary. You do not have to participate, and there can be no administrative repercussions if you refuse to participate. Do you understand that your agency cannot compel you to participate in this interview, and that your participation is strictly voluntarily?
I do.
Having that in mind, do you agree to voluntarily participate in this interview?
I do.
At this time, I'd like to place you under oath.
Yes.
This will be a sworn tape-recorded interview taken by a law enforcement officer pursuant to Florida State Statute 117.10. Please raise your right hand. Do you swear and affirm the statement you're about to give be the truth, the whole truth, and nothing but the truth?
I do.
Please state your full name and date of birth, sir.
It's Thomas Howard Wall, April 2nd, 1947.
Make me nervous. Thought you was going to smack me. Okay. And you're currently employed with the Clay County Sheriff's Office?
Yes.
And what's your position here, sir?
I'm Division Chief for Security in the Detention Bureau.
Okay. We're here today in reference to a death investigation on an inmate. And I want to show you a picture of him. His name is Daniel Joseph Lenzing-Binkler. Do you know who that is, sir?
Yes, he's an inmate in our jail.
Okay. What I want to do is just, for housekeeping reasons, at some point in time, you had some contact and was aware of what was going on in the facility today in regards to this individual. In your own words, can you just tell me what you did and what your participation was?
Oh, yes, sir. I was at my desk here on the 3rd floor of the jail, and I heard Deputy Wolf, who was the suicide officer in confinement, calling for a supervisor in confinement. This was right at 8 o'clock or a little bit before 0800 this morning. I was on my way downstairs anyway, so he had stopped by confinement, and when I entered confinement, I observed Miss Wolf up in there where the cameras were. Nurse Jenny Glenn, and my medical officer at that time, Neil McDade, were conducting medical rounds. They were probably down 2 or 3 cell doors from where Lenzing-Binkler's at. I noticed Sergeant Heaps and Deputy Holtz and Deputy Acosta and probably one other officer were trying to speak with Mr. Lenzing-Binkler. I know that I was briefed that Nurse Glenn said due to his behavior and his actions that he needed to be put into the restraint chair. He was being violent with his body. He would be slamming up against the door, kicking the door, anywhere where he could physically hurt himself, break a bone, break a foot, hurt his head, and anything. It's not an uncommon thing they do down there. So Deputy Holtzen was trying to get him to cuff up and come out and let's talk. And I had went over by the control room and watched on the camera where she had it enlarged of him inside of there. He was very mouthy, he was very loud, looking up at the camera, knowing that she's looking at the camera, and making face gestures with his fist and beating on his chest and just, being vulgar. He'd put one hand through the flap, and Holton tried to cuff him, but he wouldn't, and he backed off. And so this went on for 2, 3, 4 minutes, something like that. Just talking to him. He would not comply. He would not listen. He was not going to come out. Nurse Glenn again indicated that he needed to get in the chair before he's going to hurt himself. So they shut the bean flap, which is the steel door that shuts off the where he can't see out. So they were getting ready to figure out what we was going to do. I opened the thing and looked in at him, and he's looking right at me and telling me that y'all ain't bad enough. Y'all need to come in, come and get me. I'm not coming out. And he was just hollering, and he was going on loud and just in a combative state. I couldn't even remember what all he said because he was just looking up there and beating his chest and looking, just carrying on. Couldn't hear him real good anyway. But anyway, I shut the thing back up and I said, Sergeant Heap said, we'll spray him and we'll take him. I said, well, give him a direct order one more time to come out of there. Open this thing, give him a direct order to come out or you're coming in. Which we usually do when we get to our use of force matrix. We get to a point where we give that direct order and they fail to comply, we go. So I said go. So he refused and just took his stance in the back, and so they readied themselves and had their gloves, and Mr. Holton had his spray. So they opened the door and very rapidly went in and give him one burst, and I was standing on the stair well outside that you'd observed on where I could look in. They had went in and give him one burst of the spray, and immediately had hands on him, and where he went to the floor, they went to the floor with him and come out. There were 5 of them, so he couldn't do anything but comply, and so they brought him out. And they put him in the restraint chair, which was in a position right next to the stairwell as it faced the rooms across from it. Put him right straight into the chair, got him straightened around, and put his straps on him. And he wanted to spit, so they put a spit mask on over his face to keep from, and I know we'd give that to you. Sergeant Heaps was checking all of his restraints to make sure they were in the right place and they weren't too tight. Everything was properly applied. So that was what my observation was going to be, to make sure that they do everything, not take part. They did everything just like they should.
Would it be safe to say that he resisted and was non-compliant, but was not aggressively assaulting the officers? Is that a fair assessment based on what you saw?
Yes. He could continued to be resistant and loud, but with the...
But he wasn't trying to hurt anybody.
No, the size of the officers, he was very quickly, but and he wasn't manhandled in any way. He was very quickly removed, right from the cell, right around into a chair, and placed right in that chair, so they didn't have to tussle. They didn't have to do anything such as that with him at all.
Just a professional movement, like what y'all do.
And I looked at my phone, and the time that we sprayed him was 8:07. So then he was just extracted and
So you took
placed in the-
probably 7 minutes or so to get him to comply. Is that about right? You said around 8 o'clock earlier?
Yep. Excuse me. By the time I got up there, they had been talking to him.
Right.
So it was going nowhere. He absolutely, totally refused. And I said, we need to go get him. So they did what they did and brought him out. And like I said, it was very simple. It was very good. It was good extraction. There's nothing out of the way in the thing. So then I stayed there a little bit and made sure that everything with him looked fine, and he basically a little bit seemed to calm down right there during that time. So having that was all done and everything's back to order, I made sure she had her notes properly documented, who was here, what time, and
I heard that you mean the nurse.
no, Miss Wolf.
Okay, the actual
Yeah,
correction
Deputy Wolf. Her job is to watch all of those cameras. Her job is to document and log suicide watches every 15 minutes or less, or the observation, like on him, since we sprayed him, since we put him in a chair, he had to be on an observation watch. And every 15 minutes or less, and it can't go over, but 14 up to 15, has to be checked, it has to be documented. And if it gets into a certain amount of time, they loosen straps if they have to use the bathroom to let him. For any other reason. So I mean, it was about 1 hour later whenever the other part of the incident occurred. And I was stepped
You
up.
didn't stay there the whole hour. You went on about your
I left there within a few minutes. He was fine. He was properly seated. Everything was good. Things were back to order. And they were decontaminating the cell. I left. So, and it was a little bit later that I wasn't in here. I had left for a minute. I may have stepped out of the restroom. I didn't hear him call me on the radio. But when I found out that they had that they was having a problem with it, I went back downstairs. Of course, there was lots of people. None of them. They were right dead in the middle of CPR and doing all that. And rescue had been called. And of course, I went up to make sure that all the documentation was well in the way it should have been, and got rid of excess people that don't need to be in there, and waited on rescue, and just made sure everything was right in order according to our policy.
Sure.
I always snatch a copy of that and go with it, make sure we've covered the bases, and everything. So in the event there was a problem, I went down to get his file to see what we may need in it. I got his property in a property room, and I got everything together. Made arrangements for somebody to ride rescue if they had to go, and that was basically what I did. Of course, they took him. I put up the tape. I sealed the crime scene area off to wait for the robbery homicide unit and you guys. We contacted you guys, or they did. They contacted. Contacted y'all, and everything. You know how it went from there on out.
When he was there and they administered aid to him in the cell block, was it based upon your experience? Would you consider him to be lifeless?
No, when you say in the cell block, he's
Well,
in confinement where he
in that
was.
area down
I never
there.
saw him make. Yes.
Would you say he was lifeless when he left here?
Well,
I'm just asking.
22 years of homicide experience. I didn't see any life in him.
And that's where I was. That's why I asked.
I saw no movements. I saw no anything while rescue was working on, even watching the screens and everything else. He was to me, my observations of his body, he was lifeless. Yes.
And that's the reason why I asked you that, because I am aware of your background. And
I didn't see him do any. There's no moves. There's no nothing or anything.
No
I kept
breathing or
looking. In
anything?
fact, I kept kind of saying, "Come on, man, breathe, pop," But nothing happened. Nothing. And I know they worked it out as long as they could. And and they were administering IV stuff in him, and they were doing the normal paramedic stuff. So
now, there was some blood on the floor. Did you notice the blood on the floor?
I did, and I can tell you, I call it rescue artifacts, but they had put an IV in his right arm, and that was right where the area of the IV was placed, and they had been, like I say, that I saw nothing on him when we put him in the chair or anything else where there was any contusions or bruises or cuts or scrapes. Basically, what I saw there was that was right where the IV was, and they kept pulling stuff out and administering injectable materials.
Try to revive him.
Yes.
What else, Captain? Anything else you can think of?
No, looking at the log, I mean, they had checked him, and based on what I had received, he was yelling, he was making noises, he was right up till moving his head from side to side. He was watched very carefully, and so that it was just got to be almost an hour later from when he went down the hill. So,
now, you're making reference to a report that was filled out by people that work for you?
This was the log,
right.
The restraint
Do we have copies of all
chair
those?
log that was kept by Deputy Wolf, I believe it was. And I was looking at that because that was the first thing I looked at when I went back in there to see what the sequence of events was once he got in the chair. Did he have any
Do we
issue?
have copies of all those?
I do. Yes, sir. I've
Well,
got.
I mean, does FDLE have copies of them? Or can we get
Yeah, I'm going to
copies?
make you a
Okay,
complete copy of everything that I have.
Perfect.
Other than that, me personally, it's my job to make sure that my people do their job correctly, and the protocol they followed today and what they did and why they did it was all right in line. It was very smooth. So we didn't have to. A lot of times we tase them. Didn't have one there today. They used the spray. The spray shut him down. All that combativeness that he had and all that stuff. Once the spray hit him, he had no choice except to just kind of fall. And he kind of fell right into their arms, and he was right out, and right in the corner, and put in his chair. So nobody had to do anything other than kept trying to talk to him.
Did you have any more conversations with him once he was in the chair, or did you go ahead and just leave and resume your normal?
No, I left. I didn't. No, he was sitting there being, at the time, I left shortly after that we had him in the chair. He was compliant at that point. I didn't see any.
Do you ever remember anything he'd ever said while all this is going on? I know a lot of times that
I couldn't hear because of the echo of my hearing aid, but him and his cell block, when he was not listening, a lot of times they'll see me and they have a change of attitude only because they know I run the jail. I mean, it's just a stigma or something. They know I have the last say. But I looked at him and there was, I didn't exist. It was that look like, I'm going to do what I want. Y'all need to come get me. And I know that based on the things told to me by medical personnel that he just was off on another planet. Comments and things he made, things like that. So I couldn't tell exactly what he said. Again, it was too much. He was hollering to the point where it was a blur.
Sure.
He kept looking up at that mirror and making gestures at that mirror, beating himself on the chest. I mean, looking at the camera, I'm sorry. Mm-hmm. He kept doing that and just talking about he's bad, we're not bad. Those things, I could hear that. Come get me.
Had you had any previous problems with him like this?
They had, I wasn't down there if there was. We've had some issues with him a little bit, only because of they got him on medication, and it was only because of I say mental issues, only because of some mental things going on with him that we have things, but I don't think we've put him in the chair. I don't think we've done any other measures to him since he's been here.
But since he was in custody here, To your knowledge, had he ever been evaluated by a mental health specialist or a psychiatrist?
I don't know for sure.
Okay.
We have once or twice a week a mental health doctor that comes in the facility. If I put him, now he was on suicide watch. He was, and the only way he could get off it was he had to be evaluated by the psychiatrist doctor.
And all that stuff would be in his medical file anyway.
Yeah, oh yes. Anything and everything to do with all that stuff it's going to be in those records that we're going to get for you.
Okay, perfect. Captain, can you think of anything else?
No, sir. Sad that it happened. No, everything is fine.
I'm gonna leave you with a card in the event that you think of something you may have forgotten today. Please feel free to call me back and update me and let me know. I know that sometimes you can't remember everything all the time, but it sounds like you saw pretty much everything that happened. So
it was quick.
Yeah, it always is.
It was quick, and I'll be glad to help you get back with you in case.
Well, we certainly help. Thank you for your cooperation and all your help you've given us so far. So.
Yes, sir.
All right, that concludes the interview.
Senator Holy Cross with the Florida Department of Law Enforcement. The date is March 12th, 2013. The time is 4:35 p.m. This interview is being conducted with Clay County Fire Rescue Lieutenant Matt Everett at the Rescue 15 office located at 290 Branscombe Road in Green Cove Springs. This interview is in reference to Daniel Linson Bigler, which was a in custody death at the Clay County Sheriff's Office on this same date. Matt, just if you will, please raise your right hand. I want to swear you in. This will be a sworn statement taken by a law enforcement officer pursuant to Florida Statute 117.10. Do you swear and affirm the statement you're about to give will be the truth, the whole truth, and nothing but the truth?
I do.
Okay. Basically, today you were riding in Rescue 15 and you were dispatched to the Clay County Jail. Is that correct?
Yes, sir.
What was the nature of the call?
The nature of the call was a cardiac red.
Just somebody
unresponsive.
Okay.
Yes, sir.
And the time you got to the jail, tell me basically what happened. Just give me a scenario of what steps you...
The engine crew had arrived prior to us, had initiated patient care. Patient was unresponsive.
What engine crew was that?
Engine 20.
Where are they located at?
They are in Green Cove. Fire Department in Green Cove.
Okay.
They initiated care prior to us arriving. Upon us arriving, patient was unresponsive in the PEA rhythm. PEA, no pulse.
Okay.
Just is a rhythm on the cardiac monitor, but with no pulse.
Okay.
Engine 20 had an IV established, and the patient intubated prior to us getting there. We worked 3 rounds of meds on scene. Patient remained in the PEA rhythm, so we transported the patient to Orange Park Medical Center with CPR and artificial respirations.
Okay. And all of this emergency first aid, the first part of it took place inside Clay County.
I believe it was the second floor. We took an elevator up. We were escorted in.
It was inside where the cells are located.
Where the cells were, yes, sir.
Okay. Was he in a cell or was he out?
He was outside.
Next, he was out of his cell in the
main general area.
Yeah, exactly. I know what you're talking about. Okay. What did the officers there tell you initially? What happened?
I just talked to the Engine 20 lieutenant, and he told me that what he had found when he came in, which was unresponsive.
Okay,
PA.
you didn't talk to the corrections
I asked
officers.
him. They had to call. He called on the radio for the guy that was with him to come back and He said, I asked him how long he was down, when the last time he was that he was seen
What
speaking.
What did he say?
He said approximately 10 minutes, 5 to 10 minutes.
Okay.
Was the last time that he was talked to, and that he was restrained in the restraining chair.
Okay.
That was about all I got, you know.
Mm-hmm.
We had loaded up and.
Okay, and then following this, after the 3 rounds of meds that you guys gave, you transported him to Orange Park Medical Center. The whole time he was there, he never regained consciousness?
He was never responsive at all. No, He was unresponsive the whole time.
Okay, and then once he was at, once you got to Orange Park Medical Center, you transferred care to the nurses in the ER. Okay. And basically, the corrections officer told you he was talking when he was placed in the chair. It had been about 10 minutes.
Yeah, they just said he was in a restraining chair, and it had been 10 minutes, and then he said 5 to 10 minutes. I took it that he was giving a roundabout.
Okay. Now, did they tell you that he had been pepper sprayed or anything like that?
No, I didn't hear that.
Okay. All right. Did you see any pepper spray or smell any pepper spray, anything like that?
I did not.
Okay. All right. That's the end of the interview. I'll be terminating the interview. The time is 4:41. Hello.
Okay. Today is the 12th of March, 2013. It's about 12:30 p.m. We're at the Clay County Sheriff's Office Detention Facility. And I am Special Agent Rusty Rogers of the Florida Department of Law Enforcement. This interview is being conducted at the Clay County Detention Facility in Clay County in Green Cove Springs, Florida. I'm interviewing Detention Officer Angel Marcus Acosta. And present during the interview is Detective Tom Barnes of the Clay County Sheriff's Office. Before we get started, I'd like to confirm that this is a statement, if this is a voluntary statement, that no one has threatened you or coerced you or induced you to give this statement. Is that correct?
That is correct. Voluntary.
Okay. Has anyone from your agency commanded you to participate in this interview?
Negative.
You should understand that this is a criminal investigation. It's a death investigation, independent of any departmental administrative investigation or an internal investigation. Your participation in this interview is completely voluntary. You do not have to participate, and there can be no administrative repercussions if you refuse to participate. Do you understand that your agency cannot compel you to participate in this interview, and that your participation is voluntary?
Yes, I understand.
Okay. Having this in mind, do you agree to voluntarily participate in this interview?
Yes.
Okay. This time I'd like to place you under oath. Would you raise your right hand? This will be a sworn, tape-recorded interview taken by a law enforcement officer pursuant to Florida State Statute 117.10. Do you swear and affirm the statement you're about to give will be the truth, the whole truth, and nothing but the truth?
I do.
Please state your full name.
Angel Marcus Acosta.
Your date of birth.
July 27, 1971.
And please state your current occupation.
I am a detention deputy for the Clay County Sheriff's Office.
And contact phone number.
904-993-3939.
Can you briefly just give me a background on your educational background?
High school, I've got about 21 credits shy of an associate's degree. I'm dual certified in detention. I'm also law enforcement.
And how long have you been working for the Sheriff's Office?
I got hired in March of 2011 as a reserve deputy.
Okay. Today we're here in the matter of the death investigation of Daniel Joseph Linzenbigler. Are you familiar with this inmate?
Yes.
Tell me what you know about him.
I was here actually when he came in the prior weekend, when he actually got booked. He had came in and you could tell that he wasn't in the right state of mind actually. He had got brought in because his outside charges were basically he was running around in the nude. I believe it was at the hotel off of Wells Road. But anyway, nonetheless, he got picked up for that. Got brought in, and while he was getting booked, while he was getting fingerprinted by one of the deputies, he was basically you could just tell he wasn't in the right state of mind. He'd take his shirt off, claiming that he was Jesus Christ, and you could tell he wasn't right. At that time I asked him if he was under the influence or anything, and at that time he had stated he had taken some acid at that time.
Do you remember remember when he was brought in? How long ago, just roughly?
Well, we alternate weekends, so it wasn't last weekend, it was the weekend before that.
So it's been a couple weeks ago?
Yeah.
Okay. Yeah. When you say he wasn't acting quite right, how would you describe his behavior? I mean, other than you told me he was delusional, thought he was Jesus Christ. Anything else?
Just very erratic, just comments that he would say, and just wasn't in the right state of mind.
Any violent tendencies that you observed?
Just kept being very resistant as far as like not wanting, like when he was trying to fingerprint him, he just kept trying to pull away and not cooperative. And I believe they took him up to confinement at that time.
Okay. Fast forwarding now to today, were you here when the incident occurred, when he was extracted from the cell?
Yes.
It's not like TV. It's going to be very basic. You just tell me what you remember and what your responsibilities were and what you did.
Basically, I was assigned to G&H wing. I was the G&H wing deputy, so I wasn't the deputy in confinement. But a transmission that came over the radio that there was disruption in confinement. At that time, I responded to confinement. When I got there, Sergeant Heaps was already there. Deputy Holton was there. Right behind me came Captain Wall. Deputy McDade was already there. He was the medical officer. And Nurse Glenn was there as well. When I got there, he was screaming and yelling and banging on the cell door, meaning inmate Lisplinger.
Okay.
He kept banging on the door, kept kicking the door. At that time, Deputy Holton was trying to talk him into coming up to the food flap and cuffing up, basically letting us put restraints on him so we can pull him out and sit him on the chair so he can calm down. At that time, he kept saying he wasn't going to do it. You know, we're going to have to come in and do it and get him because he wasn't allowing us to cuff him. He also made the statement of, just give me the handcuffs, I'll put them on myself. We're like, that's not how it works. We're not going to give you the handcuffs.
What's the reason for that?
As far as not giving them the handcuffs,
right.
They can hurt themselves with it. He was on suicide watch.
Or it could be used as a weapon against someone.
Exactly. And he was already on suicide watch, which means he had nothing in the cell except the smock. So we're not just going to give him a pair of cuffs.
What happened next?
At that time, it was deemed that we should remove him from the cell for his safety. When they opened the cell door, it was Deputy Holton, then myself, and then Deputy Bloodsworth, which was the wing deputy. When we made entry, the inmate took a defensive stance. At that time, Deputy Holton pulled out his OC spray, sprayed the inmate in the facial area. He kind of boiled over, dropped to the ground, was kind of moving around. We just literally grabbed him and pulled him out of the cell and put him in the restraint chair. Once we put him in the restraint chair, basically strapped down his arms, strapped down his legs, put the straps over him, strapped him down, and that was pretty much.
What part of that did you do?
Oh, I was assisting as far as I had the shoulder part area when we were pulling him out. I had him by the shoulders, right underneath the shoulders, pulling him this way. Deputy Holton and Bloodsworth had the leg area, I believe. Yeah. Pulled him out, put him in the chair, strapped him down, meaning his arms and his legs. At that time, he was still screaming and such, and that was pretty much it. I mean, Captain Watt was present, Sergeant Heaps was present.
Okay, I noticed there's a spit mask out there on the ground.
Oh yes, yes. That was placed by it was either Deputy Holson or I want to say it was Deputy Holson that put the spit mask on him.
Were you there when that was done?
Well, after we strapped him down, he had his arm strapped. I kind of just walked away. Went up to the booth area of confinement. When I came back down, I saw that he already had the spit mask on.
So you don't really know who applied this to?
I want to say it was Deputy Holson because I know he walked away to go grab it, so I'm assuming
Okay.
he was the one that placed it on him.
But you didn't.
I
see
didn't
it,
see
you didn't
him, no.
Okay. Okay.
And I mean that was pretty much it.
Okay. Anything else you can think of?
He didn't put up a struggle, meaning like he wasn't trying to like fight us. He was making it awkward for us to grab him, but he wasn't fighting. You know, I wouldn't say he was fighting. He was just kind of moving around, which we just, like I said, we grabbed him and put him in the restraint chair. So he wasn't combative, just moving around. I think it had to do with the spray itself.
Okay. Once he was in the spit mask, and once he was restrained in the chair, the restraint chair. That's a common chair that you use to restrain people, right?
Yes. Yes.
Okay. And what did you notice about his demeanor once he was strapped in the chair?
He was still acting the same way as he was when he was in the cell, meaning he couldn't really move, obviously, because he's strapped into the chair, but he was still screaming.
What was he screaming?
Just, he kept saying things of, I can't, exact details I don't remember, but he actually would like let out yells, like, this is, then he was saying stuff like, this is, I don't know, just like, this is bullshit, and...
Did you actually hear him say that?
Yeah.
Okay. You think of
But he
anything
was,
else
but he
said?
was basically, like I said, he was just mostly just letting out like just yells and just being very loud.
Okay. You think of anything else he might have said?
No. Because once he had him strapped in the chair, I pretty much, once he had him all done, Sarge was there, everybody was there. I pretty much left because I was like I said, I was working on a different wing, so.
So you responded to the request.
I responded to the request. Well, we didn't at that time. I didn't know it was going to be an extraction. I just know that there was a disturbance.
Okay.
But once we had him in the chair, he was strapped in. I pretty much left after that.
You have any questions for us?
No.
Okay. Anything else you can think of?
No, that was pretty much.
Okay. If you do think of something, please come back forward and let us know. Okay.
Okay.
I mean, if you forget something later on,
Yeah.
you remember something, and you think it's significant, be sure and give us a call. Let me know. And I'll give you a card, all right?
All right.
Thank you, Mr. Costas.
Today's date is March 12, 2013. Time is 12:43 p.m. We attempted to record earlier around the 12:30 mark. The recorder stopped at 36 seconds. It is available. We're going to go back over some events. In the room with me currently is Becky Sue Wolf. She is currently a detention deputy with the Clay County Sheriff's Office here at the jail. Myself, John Batchelor, I'm with FDLE. We're going to go over an incident that occurred today involving inmate Daniel Joseph Linzenbigler, 526 and 93. Ms. Wolf, just so I know, how long have you been employed with the Clay County Sheriff's Office?
Since May 28th of 2008.
Okay. During that time, was there any civilian time?
Yes, sir. From till 2010.
Okay.
Yes, sir. I went to the police academy September 2009 through January of 2010. And
Okay.
I became a sworn deputy April 13th of 2010.
Good. What shift are you currently assigned to?
My team is Blue Bee, and we are 0600 to 1800.
Okay. Your assignment on today's date, March 12, 2013.
Was the Suicide Watch deputy.
And what does that kind of consist of in short?
Consists of you sitting there. There's a camera on all the inmates that are suicidal, and you sit there and watch them on camera all day, and every 10 minutes you log in the computer what they are doing.
Is these cameras inside a pod or a cell?
Yes, sir. There's a camera inside each cell.
Okay. Are you familiar with inmate Daniel Joseph Linsenbigler?
Yes, sir. He was on suicide watch.
And how long has he been on suicide watch?
I am not sure.
He was just on when you came on shift?
Yes, sir. He was on whenever I got here this morning.
Okay. Could you take us through your through your day with Mr. Linsenbigler and any events that he might have been involved in that you would have seen as part of your duties?
Yes, sir.
Okay.
I got to work this morning at 0600. When I arrived in confinement this morning, he was yelling, screaming, banging on doors. Sometime between, I believe it was 7:30 and 8 o'clock, the nurse entered confinement where he was still yelling, and he started beating on the doors extremely hard, kicking them. We actually have flaps on the doors that cover windows, and he was kicking the flaps open, banging on the doors. The nurse advised us that we needed to either contact the sergeant or get him out and put him in a restraint chair to keep him from harming himself.
What nurse was that?
Nurse Glenn.
Go ahead.
Due to how hard he was hitting the walls and the doors, was in fear that he might actually break something, either a hand, a foot, leg. I contacted Sergeant Heaps, at which time he came to confinement along with Deputy Holtzen, Deputy Acosta. Deputy McDade was already in there with the nurse. Deputy Holtzen attempted to talk to him to try and calm him down. Tried to get him to come to the door and get handcuffed to bring him out, to kind of sit him down and just talk to him for a minute. At one point it looked like he was actually going to comply with that, with Deputy Holtzen, and as soon as he got to the door, he turned around and ran to the back of the cell and sat down and said, "Y'all are going to have to come get me," pretty much. Started beating on the cell, beating on the doors, all over again. Captain Wall was present during this. Sergeant Heaps gave him several verbal commands to come to the door, at which he completely ignored all of them. He ignored all of Sergeant Heaps' commands. He told them that he needed to come to the door over and over. At that point, he told them to enter the cell. When Deputy Holtzen went to enter, he took an aggressive stance towards him. Deputy Holtzen then sprayed him. And Deputy Holtzen, McDade, Acosta, and Bloodsworth went in and extracted him out of the cell and placed him in the restraint chair. They also placed a spit mask on him due to him trying to spit everywhere on people.
Where is this restraint chair positioned?
It was then positioned directly to my right, so I could physically see him.
Okay, so you, at this point you was not looking at a camera, you were looking at
yes,
him
sir.
sitting
We
in
went
the chair.
from camera to me actually physically seeing him. I then, a few minutes later, was relieved by Deputy Center to go out and get some fresh air. Use the restroom.
You said Deputy Center
Yes,
relieved
sir.
you? Okay. Okay.
SEN.
Okay.
I came back probably approximately between 8:55 9 o'clock. Walked directly past the inmate, which I could see he was moving. I went and did my log. He was sitting there. At 9:06, I looked at him to do another log and told Deputy Center that I thought that he needed to go and check on him. Deputy Center immediately got up and walked over there and realized he wasn't breathing. He couldn't get a pulse on him. I immediately notified the nurse at 9:09. Nurse Glenn and Nurse Spinell entered confinement at 9:11. At 9:12, I contacted Sergeant Heaps or Sergeant Mitchell in booking, where he called 911. Sergeant Heaps came in at 9:13, and at 9:13 they also started this AED and CPR after getting him out of the chair. 9:15 dispatch called. I updated them. Rescue entered confinement around 9:21, and they took over CPR and they left with him at 9:43.
As part of your watch, how often do you check, have to log what they're doing when they're confined in the cell?
Every 10 minutes.
And that just consists of what you're viewing on the screen?
Yes,
you would
sir.
log down based on there?
Yes, sir.
You said early on in the shift he was kind of being disruptive, and
Yes,
that
sir.
Nurse Glenn came down and
Yes, sir.
suggested, do you know about what time that was? When Nurse Glenn came down and suggested that he be removed?
I believe
For his
she's
safety.
in confinement somewhere between 7:30 and 8 o'clock.
Somewhere in that time?
He was placed in the restraint chair at 8:17, so it had to have been somewhere. It might have been even closer to 8:45 and 8:15 that she actually came into confinement.
Okay. So from 0600 to about the 8:17 mark, you had been checking Mr. Linsenbigler about every 10 minutes?
Yes, sir.
And the
He was.
log-
I mean, he was. I saw him on camera all morning. He didn't sit down once. He was yelling and
And
screaming.
the log reflects your
Yes, sir.
observations? Okay.
Yes, sir. I think he laid down once and got right back up.
When he was placed in the chair and it was set to your right, I'm assuming is what you were saying?
Yes, sir.
Okay. You physically could see him. How often did you check him at that point?
At that point, it was still every 10 minutes, and every 15 minutes, I started a paper log for the restraint chair, and that's every 15 minutes.
So you were doing the every 10 minutes for the suicide and then
And
every
every-
15
yes,
for the
sir.
chair? Okay,
Yes,
and those
sir.
logs are documented up?
Yes,
Okay.
sir.
During that time, between 8:17 and the time that 9:06, did Mr. Linsenberger make any statements in the chair? Did he make any requests? Did he have any? Did he yell? Did
He
do
was. I mean,
anything?
he was still yelling like he had been all morning long, which was kind of gibberish. I mean, off the wall stuff. But that was all morning, and it had apparently been not
But
just
no,
since I
no
got there.
requests, nothing that you could make sense
No, sir.
of. During your relief, you said Deputy Center was your relief.
Yes, sir.
When you returned, did he tell you anything, any concerns about Mr. Linsenberg?
No, sir. He had done a log and said that he was just moving his head back and forth. He had finally, I guess, kind of calmed down, stopped yelling. He was not yelling whenever I came back to confinement. He was yelling when I left and was not yelling when I came back. I walked past him, though, and he was, I mean, moving. You could clearly see his chest moving. I mean,
And what time did you return back from your
I'd
relief?
probably say around 9 o'clock.
Okay. And then you indicated you started another watch log around 9:06, I believe.
I believe I did one at 9 o'clock and 9:06,
Okay.
because 9:06 is whenever I told him that he needed to go check him.
Okay. Is there anything else? Have you had any contact before this time with Mr. Linsenbigler?
No, sir.
You're not familiar with him other than today?
No, sir.
Okay. All right. And I think I asked you, and if I didn't, I apologize. Do you have any prior training in law enforcement or military prior to this job?
Before Clay County Sheriff's
Yes.
Office? No, sir.
Okay. I think that'll conclude the interview. It is 12:53 Nextel time.
What's that? These chairs are
Okay, today's excuse me. Today's the 21st day of March 2013. The time is approximately 10:45 a.m. And my name is Rusty Rogers. I'm a special agent with Florida Department of Law Enforcement. I am a law enforcement officer, and I'm conducting a criminal investigation. This interview is being conducted at the Clay County Detention Facility located in Green Cove Springs, Florida. Today I'm interviewing Deputy Christopher Allen Jala, and also present during the interview is Detective Wes Smith of Clay County SO. Before we get started, I would like to confirm that this statement is a voluntary statement, that no one has threatened you, coerced you, or induced you to give this statement. Is that correct?
That's correct.
And since you're an employee, I want to make sure you're fully aware of your guarantee rights, okay? Has anyone from your agency commanded you to participate in this interview?
No, they have not.
You should understand that this is a criminal investigation, independent of any departmental administrative inquiry. Your participation in this interview is completely voluntary. You do not have to participate, and there can be no administrative repercussions if you refuse to participate. And do you understand that your agency cannot compel you to participate in this interview, and that your participation is strictly voluntary?
Yes, I do.
Having that in mind, at this time, do you agree to voluntarily participate in this interview?
Yes, I do.
At this time, I'd like to place you under oath. This will be a sworn, tape-recorded interview taken by a law enforcement officer pursuant to Florida State Statute 117.10. Please raise your right hand. Do you swear or affirm that the statement you're about to give will be the truth, the whole truth, and nothing but the truth?
I do.
Okay, can you state your full name and your date of birth, please?
Christopher Allen Magella. My date of birth is 10/22/1985.
And what's your current occupation, sir?
I'm a detention deputy with the Clay County Sheriff's Office.
Okay. Okay, we're here today in reference to the death investigation that we're conducting as it relates to inmate Daniel Joseph Linson Bigler. Are you familiar with him?
Yes, sir.
Okay, that occurred on the 12th day of March 2013. Is that correct?
Yes, sir.
Can you just kind of walk me through, in your own words, any knowledge that you have concerning this incident, what your position was that day, and any kind of action that you may have taken as it is involving inmate Linson Bigler?
Yes. I was working downstairs in Brooklyn. I heard the call come on the radio. I responded with one of my supervisors.
What did the call come out as?
Medical emergency. When we arrived at confinement, I noticed Nurse Glenn performing CPR on Mr. Linson Bigler.
Now, is he in the chair, out of the chair, or where's he at?
He was out of the chair on the ground on his back. She performed CPR. I started to assist her by giving rescue breaths using the mask. And when she got a little tired, I took over and did chest compressions while Deputy Acosta gave rescue breaths.
Okay. Anything else?
We continued to do that until rescue arrived, and then we stepped away.
Okay. And did you have anything else to do with this particular inmate?
No, I did not.
Okay. Do you have any questions for us?
No, I don't.
All right. Thank you for your time.
You're welcome.
All right, sir.
All right, today's date is March 12, 2013. Present in the room here is Jared Scott Bloodsworth, Detention Deputy with the Clay County Sheriff's Office. Myself, John Batchelor, a Special Agent with the Florida Department of Law Enforcement. The time is 1:14 p.m. We're here to talk to Deputy Bloodsworth about an incident involving an inmate by the name of Daniel Joseph Linson Bigler. Did I get your name right? It's Jared Scott Bloodsworth?
Yes, sir.
Okay. How long you been employed with the Sheriff's Office here?
5 years.
5 years? From what time about? Do you have a...
My start date was December 2007.
Okay. Was you sworn when you started?
Yes, sir, I was.
Did you have to go through the academy when you started?
Yes.
And that lasted how long?
That lasted approximately 6 months.
Okay. When you came out, you went to work?
I went to work, yes, sir.
Okay. Do you have any prior law enforcement or correction experience?
No, sir.
Any prior involvement in martial arts or any other type of, training that would?
No, sir.
Okay. Your current shift that you're assigned to?
Is Blue B Security Division.
And what hours is that?
6 a.m. to 6 p.m., 12-hour shifts.
And what is your current assignment on today's date of March 12, 2013?
Security section.
And what is the security section?
It's part of the jail that, as a detention officer, you control care of the inmates.
And is there any special inmates in this? Why are they in this particular section? Is there any reason?
Some of them are in there for disciplinary reasons, and some of them are in for suicide risk reasons.
Okay. Are you familiar with an inmate by the name of Daniel Joseph Linson Bigler?
Yes.
Okay. Do you know what cell he would have been and where he would have been housed in the jail?
He was in confinement cell number 2.
And have you had any contact with Linson Bigler prior to today?
No, sir.
Okay. Can you tell me how you came in contact with Mr. Linson Bigler today and any events that transpired with him?
Today I was assigned to confinement wing officer, and he was housed in cell number 2, and I came in contact with him by that way. I was there.
Okay. And can you tell me about any events or the incident that occurred today?
Yes, it all started with him wanting a pencil to fill out a inmate request form. I'm not sure what the inmate request form was about. He was wanting a pencil, and I didn't give him a pencil because he's on Signal 60 watch, and due to his current state of mind of how he was acting crazy. I didn't want to give him a pencil because I figured that would be in my best interest not to do that.
And what is Signal 60? I'm sorry.
I'm sorry. Signal 60 is suicide watch.
Okay.
So I am in best interest. I didn't want to give him a sharpened pencil for him to fill out that request, and in hopes that he will give it back to me without any problems. And and that's when he became disruptive in the cell block. He started kicking the cell door, punching the cell door, extremely hard, to the point where the door flap was flying open, the window flap that's held together by a magnetic force magnet. And as I was trying to calm him down, he didn't want to comply with any orders given to him. And at that time, Deputy McDade, which he is the medical officer, he was escorting Nurse Glenn around in confinement for medication rounds. And at the time of the disturbance, he heard the disturbance, so he came down to cell number 2 where I was standing. And he attempted to calm this inmate down without any compliance either. And he continued to kick the door as hard as he can, as punching it. And then at that time, the control room officer, Deputy Wolf, she called for the security supervisor, Sergeant Heaps, to respond for assistance. And she did that over the radio. Along with Sergeant Heaps, the security commander, Captain Wall, came. And other wing officers, which included Deputy Holtzman and Deputy Acosta, also responded to confinement to help to assist with the disturbance that was going on. When Deputy Holtzman got there, he attempted to calm down the inmate in cell 2. He tried to talk to him, try to reason with him, try to see what he needed, without any available compliance at all. And at the time, Sergeant Heaps came in behind him. They all came, within at once, moments later. And he didn't want to comply with anything. So Deputy Holson asked him to cuff up, and he said, "No, fuck you. You need to come in and get me." And at that time, that's when Sergeant Heaps ordered to enter the cell, make entry, to put him in the restraint chair because of his disturbance and self-harm. When I opened the door per the order of Sergeant Heaps, Deputy Holson entered the cell block, the cell, in cell number 2. And at that time, the inmate took an aggressive stance, raised up his arms. That's when Deputy Holson had to pull out his pepper spray to administer a burst of pepper spray in the facial area. Once he got done with that, we got him. We escorted him to the restraint chair, and while we was putting him in the restraint chair, I was making sure his legs was secure in the restraint chair. After I got done securing his legs and his ankles, I then proceeded to secure his waist strap. And then, as I was doing that, I'm not sure who it was, but someone ordered a spit mask placed over the inmate because due to him starting to spit, spit mask was placed on him. Again, I'm not sure who was the one that did that at the time. I looked up and I saw that spit mask was already placed on him, and I made sure it was proper fit. Make sure all the restraints were on him properly on the restraint chair. Make sure everything was good. And then after that, a 15-minute observation log for the restraint chair was immediately started.
Who monitors that log?
The control room officer. She's called the Signal 60 officer, but that was Deputy Wolf at the time of this incident, and she was a control room officer in confinement.
And what happened after that?
A few minutes later, he was still in the restraint chair. Deputy Centers, he was the rover, which means he's just all around. He's kind of helping out the team. He was an extra guy on the team. He he came into confinement to relieve Miss Wolf so that she can get out and get some fresh air because of all the OC spray that was in the air. When she came back, I went out so I can also get some fresh air and also to get some water because we were out in confinement. As I was getting some water while I was being relieved by Deputy Centers, I heard on the radio that Deputy Wolf was calling Sergeant Heaps to head back to confinement. And at that time, I thought that they were going to take him out of the restraint chair, and I was wondering that in my mind, why would they be taking him out of the restraint chair already, because it hadn't been that long. And then as a few minutes went on, I heard that the nurses needed to come to confinement and all that, and a bunch of radio traffic where the nurses needed to come down there. And by the time I got up there, I saw the inmate laying on his back, his arms spread out, and Nurse Glenn was administering CPR. She was performing chest compressions with the AED attached, the defibrillator attached to his body.
Did you do anything at that point other than just watch?
Well, after Nurse Glenn was performing CPR, chest compressions, I should say, Magella took over. After a few minutes of Deputy Magella performing chest compressions, I asked him if I needed to help him with that, and he said no. And then a few minutes later, EMS arrived and started performing CPR and tried to revive the inmate.
Right, when you removed Lindsay Bigler and from there to the chair, did it remain in his cell?
No, the chair is, we rolled it out in front of his cell. We put him in the chair. Sergeant Heaps told me to roll the chair into the cell, so I did. And then a few seconds later, he told me to pull him back out of the cell because he didn't realize that the OC was still in the air. So we put him back out of the cell, but he was in the cell no longer.
Was he in sight of you at that point?
I'm sorry?
Was he in physical sight of your position?
Yes.
Could you hear him?
Yes.
Did you walk by him at any time? Did he say anything to you?
Yeah.
At any time?
Yeah, he was just saying that he's sorry, to let him out of the chair, and he's just crying and moving his legs back and forth, due to the OC taking effect on the skin.
Did he tell you that, or you just suggest?
Not that I remember. I don't remember him.
Did he complain about anything?
He just complained of being in there. That he wanted to get out of the chair.
You were talking about the straps and the chair improperly. Have you received training on how to use the chair?
Yes, sir.
Okay. How many times have you estimated that you've assisted with the chair or worked with the chair? Just an estimation.
Estimation over 5 years, I would say 20 times approximately.
Okay.
That's a big guess.
That's just an estimation. Okay. Is there anything else you'd like to add?
No, sir.
Okay. Do you have any questions for me?
No, sir.
Okay. This concludes the recording at 1:25 Nixtel time.
Okay, today is the 20th of March 2013. It's approximately 10:15 a.m. and I am Special Agent Rusty Rogers of Florida Department of Law Enforcement. I'm a law enforcement officer conducting a criminal investigation. This interview is being conducted at the Clay County Jail, or Clay County Detention Facility in Green Cove Springs, Florida. I'm interviewing Linville Lamar Center. Before we get started, I'd like to confirm that this statement is a voluntary statement and that no one has threatened you, coerced you, or induced you to give this statement. Is that correct?
Yes.
as part of Garrity cleansing, has anyone from your agency commanded you to participate in this interview?
No.
You should understand that this is a criminal investigation, independent of any departmental administrative inquiry. Your participation in this interview is completely voluntary. You do not have to participate, and there can be no administrative repercussions if you refuse to participate. Do you understand that your agency cannot compel you to participate in this interview, and that your participation is completely voluntary?
Yes.
Having that in mind, do you agree at this time to voluntarily participate and give this interview?
Yes.
Okay. At this time, I'd like to place you under oath. This will be a sworn, tape-recorded interview taken by a law enforcement officer pursuant to Florida State Statute 117.10. Please raise your right hand. You swear and affirm the statement you're about to give will be the truth, the whole truth, and nothing but the truth.
Yes.
Please state your full name.
Lenville Lamar Center.
And your date of birth.
12/28/1967.
And what's your current occupation?
Detention deputy.
And how long have you been employed?
About 7.5 months.
Okay. And you're employed by Clay County Sheriff's Office?
Yes.
Okay. Do you have any objection to this being tape recorded?
No.
Do you understand, once again, this is a voluntary statement?
Yes.
Okay. There's no one else present during the interview except for myself and Deputy Center. And I want to bring you back to the 12th. And at some point, you become involved in the incident whereby inmate Linsenbigler died in custody here at Clay County Jail. In your own words, can you just go through what you know and what you experienced and what your particular part in that was?
I came to confinement to relieve Deputy Wolf. She needed a break to step out and give her some fresh air.
Did she say why she needed fresh air?
Yeah. Well, she was fanning her face with a clipboard, and her nose was running a little bit. But she just said, she needed a break.
Is it your opinion that that was the effects of the pepper spray that had been sprayed on the inmate?
Yes.
Okay. Could you smell the pepper spray?
Yes. Well, I don't know if I could smell it, but it was. I sneezed like 4 or 5 different times.
Was it starting to affect you?
Yes.
Okay. So it was pretty much in the air?
Yes, it was definitely in the air.
Okay, and he's in the tie-down chair at this point when you get there? Is that correct?
That's correct.
Okay, and what happened next? How close is he? How close are you to him?
I would say maybe I walked past him. I would say maybe 39. Maybe about 10 feet. I would say.
Okay, now you're in the center pod, that area where all the cameras are.
Yes, sir.
Is he seated directly at the bottom of the stairs to the right as you go down the stairs?
Yes.
Okay, so you could actually see him?
Yes.
Could you hear him?
Yes.
Could you see that he was alive?
Yes.
Okay. What happened next?
Well, when I came in the building, he was yelling or just kind of hollering in the chair.
Could you distinguish what he was saying?
No, he wasn't saying anything. He was just kind of yelling, kind of like he was mad, yelling. But he wasn't saying anything. When I got in the booth, I sat down in the chair. In the time that I was in there, I made one log on the paper log that after, I'd say maybe a couple minutes, maybe 3 minutes after I got in the building, he stopped yelling. He was moving his head from left to right.
Was he doing it violently or slowly or?
Violently. At one point he was shaking, trying to act like he was trying to get out of the chair. And I logged that one on the paper log that he was moving his head from left to right. And the other times that I looked at him, he was moving his legs inward, outward, still shaking his head. So,
how long were you there, and how long did you observe him? Would you just guess?
I would say maybe 20 minutes.
Okay. And you made all your entries on the paper log?
Yes.
Is that the same log that would be on the outside of his door?
This was a whole a different log.
Okay.
That they did up once you put somebody in a restraint chair. You have that log right there, the paper log.
Okay. When we finish here today, would you go get me a copy of that log?
I wouldn't know where it would be at.
Okay. Well, we can give it a Sergeant Heaps, and maybe he can help us.
Okay.
Okay. What happened next?
After that, when I made the log at 9:45, or it was 8:45. Like I said, when I looked at him, I probably looked at him maybe 4 to 5 different times in those minutes. And like I said, he was doing his legs in and out, and he was still moving his head side to side. Nothing much changed.
Okay. Now I understand there's also a computerized log where
Yes,
you can
sir.
make entries. Did you make any entries on that log?
No, I didn't make any entries on the computer log.
Okay. Who would have made those entries for the time period that you were there in the observation booth?
The time period that I was there, nobody would have made them.
Okay. If there was entries in there, there would be a time gap of say 20 minutes or so?
Yes.
Is that correct? Okay. And then Officer Wolf would make entries once she came back and relieved you, is that correct?
Yes, yes.
Okay. Why didn't you make entries into the computerized log?
When I relieved her, she was telling me about the juveniles, and she said you just have to make the logs. And they was about, I don't know, probably 10 or 11 different logs on the computer, and she was pointing to them, and she said just do from here down. And I didn't, when she said to put the log on the paper log with a restraint chair, I thought she told me that I didn't have to put anything in a computer, just do it on a paper. But when she got back, she said, no, you got to do them on a computer and on the paper log.
So it's basically just a miscommunication?
Yeah, yes, sir. Yes, sir.
Okay. What happened next?
Miss Wolf got back. It was about, I would say, probably a couple minutes till 9 o'clock.
Sorry. Your question, paperwork?
Thank you.
She took over. Mr. Bloodworth, Deputy Bloodworth, after Miss Wolf got back, he said that he'd like to take a break, get some fresh air. So I said that'd be fine. I sat down in his chair. I looked probably at my DMSs.
And what's DMSs?
It's a thing that they have on the computer that you read them every day. There's so many of them.
Like a pass-on log?
No, it's just like standard operation procedure, general orders. Just kind of review different ones that they put on there for you. And I was just making sure that I was actually seeing how many I had on there. I tried to keep them, down low. And I was looking at them, and it was probably, I don't know, maybe 5 minutes, maybe. Deputy Wolf asked me to go check on the inmate was in a restraint chair.
Lindsay Bigler?
Yes.
Okay.
And I went over and checked on him, and I couldn't get him to respond to me. And after that,
describe to me what you're seeing.
What I saw?
Yeah, when you go up and you approach him and you do a wellness check on him in the chair, just describe to me in your own words what you see.
I saw Lindsay Burglar in the chair. I asked him, I called to him, I asked him, was he okay? He didn't respond. I got him by the arm, and I shook his arm, and I yelled, not yelled, but I in a loud voice, asked him, was he okay? No response. I told Miss Wolf he wasn't responding. She got on the radio immediately and called for medical. And while she was doing that, I took the spit mask off of him, And
Well, describe for me what you see when you take the spit mask off.
he was.
Was there any mucus or any
No.
kind of debris on the mask or anything like that?
I didn't see anything. I just, it was real quickly. Just took the mask off of him.
Did he appear to be breathing at that point?
I couldn't really tell, but I was trying to feel for a pulse. But in the same time, I was trying to get him out of the chair also. I managed to tried to do one of his arms, and at that time, Mr. Nickel came in. He assisted me, and then
Who's Nichols?
Deputy Nickel.
Deputy Nichols?
And then after that, there was the two nurses and Mr. McDade, the medical deputy. Once they got in there, we got him.
What's Deputy Nichols and who else?
Deputy Nichols was the first one to arrive.
Okay.
And then Deputy McDade and the two nurses. Can't think of the nurses' names.
Okay, that's fine. Okay, what happened next?
After that, once they got in there, we had him. We laid him out we got him out of the chair, laid him out on the floor, face down, and the nurse had one of those. I think it was an EAD box with the pads.
Defibrillator?
Yeah, they put them on there, and immediately started CPR.
Okay. What happened next?
They continued to do CPR.
At that point, are you pulling away from them, or are you involved in the CPR?
No, sir.
Okay.
I was just there while one of the nurses was doing CPR. The other one was behind her, doing something to the machine, I think, maybe.
Do you remember who was doing the CPR? Well, you don't remember the names.
I don't remember the names.
Okay. That's fine.
And they continued doing CPR. There was deputies coming in. I couldn't tell you who came in next. Lieutenant, sergeants, captains. A bunch of people came in there. The rescue camp got there.
So at that point, you're pretty much out of the mix?
Yeah.
Can you think of anything else?
No, sir.
Anything that, any comments or anything that's been said by the nurse while all this is going on, or by the other deputies that are in the room? Any kind of exchange of words or anything being said?
Well, we thought that he was breathing at one time, and a deputy, I'm not sure who it was, said, I think he's breathing. I think he's breathing on his own, but it was when we was pushing air into him.
Right.
It was coming up. His stomach was coming up a little bit.
Okay. Do you have any questions for me?
No, sir.
Do you have anything else you'd like to add at this point?
No, sir.
Okay. Let me give you an open invitation that if you do remember something later on,
Yes, sir.
please feel free to call me.
Okay.
Get a hold of me, and I don't mind coming out, or we can talk over the phone, and if there's anything else you remember. Okay?
Okay.
All right.
Today is Tuesday, March 12th, 2013, approximately 12:50 hours. This is Special Agent Powell with the Florida Department of Law Enforcement to speak with Rod Holtzson at the Clay County Jail. Okay, Rod, basically just take me through from the very beginning contact you had with Daniel Linsenbigler. Is that how you say his name?
Yes, sir.
Okay, and just just kind of run me through, what happened with it.
Okay. I was assigned to Delta Wing, and in between my travels, I overheard basically an officer needed assistance. There was a disturbance in confinement.
You know about what time?
It was around 8 o'clock, 8:15, somewhere in that ballpark.
Okay.
So at that time, I proceeded. Of course, it's a busy time.
Yep.
Court and everything else, but I was finished with my tasks. So I headed over there. I'm a senior officer on the team, and I'm known for being able to talk to people.
Okay. Now, what team? You said on the team?
My team is B team.
Okay.
We have
all right.
4 teams assigned
Okay.
to the jail. So, when I arrived on scene, confinement, cell 2, the inmate was banging, screaming, kicking the door. And I went up to the door, had Deputy Bloodsworth and McDade step aside, new face, thought I could resolve the issue. I talked to him for a few minutes, got him to calm down. He was cursing, screaming, very irate. I did a lot of hand sign language, saying he wanted to protect himself, and I didn't know what he meant by that, and I was trying to get him to explain to me what did he mean, protect himself. At that point, I've never had any contact with this inmate before.
So this is the first time you've
That's
ever...
the first time I've
Okay.
ever dealt with him. I went and pulled myself away after I got him calmed down a little bit and found out, what he was there for, and that, possibly he's, crazy.
Mhm.
So with that being said, he started yelling and screaming again. I went back to the window, talked to him, got him calmed down again. At that time, Captain Waugh arrived on scene, Sergeant Heaps arrived on scene, along with Deputy Acosta, and of course Deputy Bloodsworth was already there, and Deputy Wolf was monitoring all the monitors of all the inmates. Tried to calm him down. Basically, I wanted to make entry into the cell, so I asked him if he'd cuff up so I could talk to him.
And cuff up's when they put their hands outside
Put
the
their
window.
hands out the
Okay.
bean flap and cuff up. At that point, we can transport the inmate. He said he started to do it, and then he pulled back as I was starting to put the first cuff on. Everything at this point was very low key, no yelling, screaming.
Okay.
And I explained to him, once again, I talked to him real calmly and brought him down. Told him, I'm here to help you. What's wrong? And he went again off the handle. He said, "No, I'm not going to cuff up. Throw me the cuffs. I'll cuff myself up." I said, "Buddy, I can't do that. That's something we can't do. It's not policy. If you cuff up, I'll come in there and I'll get to talk to you, and we'll figure out what's wrong with you. See what I can do to help you." At that point, he said, "No." I lost him again at that point. He became loud. And
Does he be violent? Is he banging on the walls? Or
he was kicking. When I first came in, he's kicking the door, punching the door, which happens very frequently in confinement. And at this point, not knowing his mental state, I didn't want him to hurt himself. He was already in a suicide gown. At some point, he took that off in his rage.
Okay, so what was he wearing?
He was naked
Okay,
at one
nothing.
point.
Okay.
And then I asked him to put his clothes back on, and I'll talk to him, and I'll treat him like a man with respect. And once again, had him calm down. This transpired about maybe 7 minutes of me trying to calm him down. Doing a pretty good job. However, it was like a light bulb switch, on and off, on and off. So at the point where he started getting angry again, I backed off and I talked to Sergeant Heaps and Captain Waugh. Captain Waugh then went to speak with him. And he told him, "Listen, we're going to help you, just relax. No, F that." He said, "Listen, you keep banging on the door." I walked away, so knowing how things go, I know what he was saying is basically calm down, relax. If you keep doing this, we're going to have to come in there and get you. At that point, when I heard this, we're going to have to come in and get you, I decided to put on some gloves and knew that more than likely this guy's going to keep banging on these doors. And it wasn't so much the sound, it's the force that he was using. Potentially he's going to hurt himself.
Okay.
So Captain Waugh and Sergeant Heaps were talking about we need to go ahead and put him in the restraint chair till he can calm down. At this point, I put on my gloves. It's determined we're going to make entry. Prior to making entry, Sergeant Heaps is saying, "You need to spray him. You need to spray him."
I personally don't ever use spray.
Right.
I mean, I'm a big guy. I don't generally need spray. I'm not a fan of it. I don't like it. It gets on me, gets on the officers. It's just, I can't stand it. Anyway, he reiterated, you need to spray him, and then we'll put him in the restraint chair. Okay? I make entry. The door's open. I make entry.
So who else went in? You were the first one in?
I'm the first. I'm primary.
Okay, so you're first in cell?
Right. He takes the slinger, or however we say his last name.
Okay. Daniel. Call him Daniel.
Let's do
Yeah,
Daniel.
call him Daniel.
Daniel takes this defensive stance, which is very common. Once again, I'm a big guy.
Right.
It wasn't a major physical threat to me. I knew I could control him. I go to place my hands on him. He gets in a defensive stance. I give him a quick burst of oleoresin spray to the facial area.
Okay.
He immediately bends his neck over, coils over, and closes his eyes. At that point, there is no fight. I mean, there was never a fight. He pretty much is given up.
How you said second-wise, what would you think the spray was? Like you said, a quick spray in his face.
Probably a second.
Okay.
A second. Just
that quick.
burst.
Okay. Yep.
Yeah, I mean, because we were right there. It's a very enclosed area. I know what this stuff is, and I'm not a big fan of it.
Okay.
So anyway, quick burst.
Yep.
He immediately basically gives up. I mean, at that point, there's no There's no fight. There's no tussle. There's no nothing. I grab him by the signals, the smock, the suicide smock, and I hand him off. He's not swinging his arms at this point. I hand him off to Acosta. They escort him out of the...
So Acosta was in there with you?
Acosta came behind me. Again, the cell is very small, and I'm a big guy. You got a bunk, so...
So it's basically you in there and Acosta behind
me, and then Bloodsworth.
Okay.
At which point, once you spray in that little confined area, I don't care if it's a millisecond, it is a very powerful powerful gas. So therefore, I passed him off to them, and they escorted him out. I come out. By that time, he is in the restraint chair. We had it staged up outside.
Okay, so you don't know who, but somebody out there put him in the...
I believe Acosta and Bloodsworth placed him in the chair.
Okay.
At that point, Sergeant Heap says, "Get me a spit mask." I walk over to the control room booth, and I take off my gloves because I have spray on the gloves. I take off my gloves. Deputy Wolf throws me a spit mask.
Okay. So immediately when Daniel got in the chair is when Sergeant Heap said, was he spitting already?
Well, yeah, he already started spitting.
Okay.
I don't know if it got in his mouth or what.
Okay.
I mean, it didn't seem like it was intentional aiming at officers.
Right, just spitting the stuff out.
He was just spitting it out.
Okay.
So I'm assuming it got into his mouth or what have you. At which point I brought the mask back and put the net over his head.
Okay.
At this point, he's in the restraint chair. They secured him, and basically at that time they're saying, "Okay, you need to do the report," and since you did the use of force, it's, standard protocol.
Okay.
Everything was followed by policy, no problem.
So you left at that time?
I broke away because there was no fight. Plus, once again, I don't like the smell of that stuff, so I'm leaving confinement.
Okay, so you're done, and then...
I basically break away. I'm finished. I have no further contact with the man. I come to 2A control, which is right here. There's a shared computer, if you will, a free computer, and I start my simple incident. This is something that happens frequently. With a standard disturbance in confinement, I responded, and what occurred? I wrote a simple little incident report. While I'm writing that incident report, I hear over the radio, we need medical to respond to confinement. And I said, what the heck's going on? So I stopped writing the report. I returned to confinement, at which point I see Daniel on the ground, and it appears that they're starting CPR.
Okay. And that was the nurses here, right?
That was the nurse.
Okay.
EMS wasn't here at that time. Nurses were here, and a couple of deputies were on scene.
Okay.
And they were doing CPR on him.
Right.
And I'm like, what the heck happened?
Yeah.
So that's basically it.
Okay.
I mean, at no other time did I have any contact with the man, just that brief moment.
Just the one incident there.
The one incident,
Okay.
and all I can tell you is everything I told you is factual.
Yep.
And everything was followed by policy and procedure.
Okay. Now, have you personally used the mask after the pepper spray? Like if somebody, or even seen it, somebody get pepper sprayed and then put the spit mask on?
Oh yeah.
Okay.
Yeah.
And never any problems?
Oh, this is common.
Very common. Okay.
Almost 90% of the time when you spray somebody, you usually use a spit mask.
Okay.
The spit mask is basically a hood with a net on it.
Right.
And it's just for officer safety, so sputum doesn't get thrown in their eyes or what have you.
Okay.
He could breathe. He was talking. He was fine.
So he was talking when he had the mask on?
Yeah.
Okay.
He said, I'm sorry, I'll be good.
Okay. Okay.
Those, at that time I'm breaking away. I had no contact with the man.
So you're done. Okay.
That was it.
Okay. Anything else?
No, it's just a sad story.
Yeah, unfortunately.
It's very unfortunate, and I don't know of anything that could have been done differently. I mean, you go to school, you learn. I've been doing this like 13 years. You hear about excited delirium. I'm not a doctor, of course, but I mean, it's very unfortunate and very sad.
Yeah, it is.
Because he's a young boy, and
it is.
Everybody did everything they could do to save the kid.
Yep.
I mean, nonstop. Trying to get him back.
That's a nurse said she was
She
nonstop
didn't
in the
give
CPR.
up. She nonstop from the point he became unresponsive.
Yeah, right.
So it's very, very sad.
it is unfortunate.
And I'm sorry. I mean,
okay.
Terrible.
You swear everything you told me was the truth?
Swear to tell the truth, whole truth, nothing but the truth.
Okay. This will conclude our interview. It is approximately 13:04 hours.
Let me go ahead and get you sworn in first, okay? Today is the 20th of March, 2013. It's about 10:45 a.m. I am Special Agent Rusty Rogers of the Florida Department of Law Enforcement. I'm a law enforcement officer and I'm conducting a criminal investigation. This interview is being conducted at the Clay County Detention Facility in Green Cove Springs, Florida. And today I'm interviewing John Henry Jarvis II. Also present during the interview is Sergeant Robert Heaps as an observer only, since the inmate's in custody and in confinement. Before we get started, I would like to confirm that this statement is a voluntary statement and that no one has threatened you or coerced you or induced you to give this statement. Is that correct?
Yes, sir.
Okay. At this time, I'd like to place you under oath. This will be a sworn, tape-recorded interview taken by law enforcement officers pursuant to Florida State Statute 117410. Please raise your right hand. Do you swear or affirm that the statement you're about to give will be the truth, the whole truth, and nothing but the truth?
Yes, sir.
Okay. Do you have any objection to this interview being tape-recorded?
No, sir.
Okay. Do you understand this is a voluntary statement that no one can make you make, nobody can force you or threaten you or anything like that to give this statement? Okay. Please state your full name and your date of birth.
John Henry Jarvis II, 1/4/1974.
Okay, Mr. Jarvis, tell me today how I got the information or how the information was put out. I received a letter.
Yes, sir.
And the letter was written to apparently your attorney.
Yes, sir.
And your attorney passed it on to Chief Investigator out in Kelly. And that's why I'm here to interview, because you said in that statement that you had information concerning the death of inmate Daniel Linsenbigler. Do you remember what day it was that this happened?
I'm not really sure. I mean, as days go, it's hard to keep track of days and confinement.
Okay. In your own words, just tell me what you saw or heard. And as you describe, be sure to tell me that you saw it and heard it, or you just heard it. Okay.
Well, I heard an inmate hollering that he needed a pencil, and this went on for a good hour and a half. This was before, I know before before the 6 o'clock shift change, that one of the officers that was communicating with him was Officer Fennell. I mean, it was like in a heat exchange. Quiet.
And was Officer who?
Officer Fennell, before he had left for the 6 o'clock shift.
Okay, go ahead.
And it continued on for, I guess it had to have been longer than that. And it lasted for a while. Then officers come in to restrain him. I heard him come into the cell downstairs below me, one cell over below me.
Did you hear any of the staff, deputies, give him any commands? Or any instructions?
Heard him told him to cuff up.
Cuff up means what?
Come to the door, sticking your hands out the door, cuff up.
Yeah, so you heard the deputy say that?
Yes, I did hear him say that.
And what was the response of Mr. Lindsay?
I mean, it sounded like that he had cuffed up. You know, maybe he had come to it, and then usually they would tell you more than once. I mean, if you didn't cuff up, they would say it, you know what I mean? And then I heard the door slam open, and then just a grunting, wrestling around type situation. And then what I heard what I thought was a taser being used, and then Daniel going quiet, which would be natural. And then the next thing I know, he was quiet for a little bit. My nurse come to the door because I get medication.
Which nurse was that?
Miss Jenny, I believe.
Okay, go ahead.
She come to my cell with an officer. They opened up my flap, opened up the thing where I could see out to talk to me. She gave me my medication. As she was giving me my medication, she was coughing, in which every officer in the whole thing, you could hear everybody coughing downstairs that was in the area. They were all coughing. She come upstairs, she had tears in her eyes and she was red in the face. And I was just jokingly saying, I said, wow, they spray you too? She was like, they sprayed enough for everybody. And we talked for a second and then she left, and I mean, I could see downstairs that.
At that point, tell me what you see.
I seen him in the restraint chair. Officer, I've seen the backside of the officer standing over him, and he was stating, I can't breathe.
Okay, describe to me what you're seeing as you see him in the chair. What are you seeing? Describe for me what you see.
I see the backside of an officer, and I can see something over the side of his head, and he's sitting in the chair like this. And the officer, he's saying, I can't breathe. And the officer over top of him says, if you can talk, you can breathe.
What is he dressed in?
It was a short second, and they shut my flap back. And then, because I kind of looked, and they was kind of, you know. Other than that, then I heard him for several minutes after that. Can't breathe, and he was saying, I can't breathe, and it just got weaker and weaker and weaker until you could hardly hear him anymore, like gasping for breath. And then that was it. And I went to sleep, and then the next day I wake up to the newspaper stating that that boy passed away. It's like, wow. I mean, now I think about that all the time, and it's like, I heard him taking his last breath. So. That's the way I see it.
Mr. Jarvis, do you have any questions for me today?
Yes, sir.
Okay, do you have anything to add to your statement at this point?
Yes, sir.
Thank you for coming forward. And this concludes the interview of John Henry Jarvis. Okay, today is the 21st of March 2013. It's approximately 10:15 a.m. And my name is Rusty Rogers. I'm a special agent with the Florida Department of Law Enforcement. I'm a law enforcement officer and I'm conducting a criminal investigation. This interview is being conducted at the Clay County Detention Facility in Green Cove Springs, Florida. I'm interviewing Nurse Melissa J. Spinell. And before we get started, also present in the interview is Homicide Detective Wes Smith from Clay County SO. Before we get started, I would like to confirm that this statement is a voluntary statement and that no one has threatened you, coerced you, or induced you to give this statement. Is that correct?
Yes, that's correct.
Okay. Since you are an employee working for the Clay County Sheriff's Office in the capacity of a nurse, I want to advise you of your garrity rights. Has anyone from your agency commanded you to participate in this interview?
No.
You should understand that this is a criminal investigation, independent of any departmental administrative inquiry. Your participation in this interview is completely voluntary. You do not have to participate, and there can be no administrative repercussions if you refuse to participate. You understand that your agency cannot compel you to participate in this interview, and that your participation is completely voluntary.
Yes, I do.
Having that in mind, do you agree at this time to participate in this interview?
Yes, I do.
Are you aware this interview is being tape recorded?
Yes.
Okay. Do you have any objection to it being tape recorded?
No.
Okay. This will be a sworn recorded interview taken by a law enforcement officer pursuant to Florida State Statute 117.10. Please raise your right hand. Do you swear or affirm the statement you are about to give will be the truth, the whole truth, and nothing but the truth?
Yes.
Could you state your full name and your date of birth?
Melissa Jean Spinell, September 6, 1953.
Okay, please state your current occupation and your employer.
I'm a licensed practical nurse and I work for the Clay County Sheriff's Office.
Okay, and you work, what is your assignment here at the, you work in detention facility?
Yes, I do.
Okay, so you deal with the care of inmates?
Yes, I do.
Okay, the medical care.
Right.
Okay, we're here today in reference to Daniel Lanson-Bigler, an inmate who is housed here at the detention facility, and I want to take you back to the 12th of March 2013, when apparently you responded to a medical emergency that you were made aware of, and ultimately it was declared at the hospital that Mr. Lincoln Bigler was pronounced dead. And we're conducting that death investigation now. Can you just tell me in your own words what your involvement was and anything you would have seen or heard as it relates to this incident?
I was in the medical department doing vital signs for Dr. Martin, and they called and said there was an inmate not breathing. I went upstairs.
Do you remember about what time that was?
It had, no sir, around 9:30. So I immediately went upstairs. The inmate was sitting in the restraint chair. I asked the officers to take him out of the restraint chair. I held the chair to help steady it as they unbuckled him and told them to place him on the floor.
Okay, as you're entering into the confinement cell area, and where is that restraint chair located?
It was underneath the stairs.
But is it right next to the observation pod where the officers sit and watch the videos?
Yes, I do believe so.
Okay. And what was your observation when you first saw him sitting, inmate Linson Bigler, in the tied in the restraint chair? What did you see?
He was sitting in the chair. His eyes were slightly open and his mouth was wide open. He had a grayish color to his skin.
Did he have the, do you know what a spit mask is?
Yes, I do.
Did he have a spit mask on when you got there?
No, he did not.
Okay. Do you know where the spit mask was at that point?
No, I do not.
Okay. What happened next?
So I held the chair and they unbuckled him. They laid him down on the floor. Jenny and another officer started CPR.
Who was Jenny?
Oh, I'm sorry, Nurse Glenn.
Nurse Glenn?
Yes, started CPR. I got the AED and opened it up and got the pads.
You know, there was two people who performed CPR, Nurse Glenn, and who was the other person?
Oh, I can't think of his name now. I'm sorry.
Was he a detention
Yes,
deputy?
yes. Magellan is his name.
Okay.
Officer Magellan. And then rescue came and they took over. And that.
When you walk me through the procedure for the AED that you did that day.
I just opened it up. You basically follow the instructions of the AED machine. You put the pads on them and then it'll tell you to do the CPR, when to stop, and you just follow the instructions.
Okay, as you did those instructions, did you place the pads on the inmate?
No, I handed them to Nurse Glenn.
Okay, did you monitor the AED
Yes.
unit?
Yes.
And tell me what's going on with the AED unit.
It was giving instructions.
And what were those instructions?
Was to do the CPR, and then a couple of times it said to stand clear, but it never did never shocked him.
And why would that be in your understanding?
Now I know is because he was a flat line.
By flatline, his heart wasn't beating?
Right, correct.
So it would be safe to say that his heart was not in defibrillation?
Right.
Okay. If that occurs, the AED unit will not work, is that right?
That's my understanding now. I didn't realize that at the time.
Okay. Is there a printout or a report that's written that comes off the AED?
Yes.
Do you know where that report is?
Major Smith would have that.
Was that made a part of his medical file?
I would assume. I honestly do not know.
Okay. Okay, what happened next?
Rescue arrived and they took over and tried to revive him.
Okay, at that point, did you do anything else?
No. Me and Nurse Glenn and I, we stood to the side and watched rescue try to revive him.
Okay. Do you have any questions for me today?
No, sir.
Okay. This concludes the interview.
Okay.
Thank you very much for your cooperation coming in.
This is Special Agent Greg Holycross of the Florida Department of Law Enforcement. The date is March 12, 2013. The time is 11:44 a.m. I'm at Orange Park Medical Center, and I'm interviewing Nurse
Amanda Varancic, V as in Victor.
How do you spell your last name? Go ahead.
V as in Victor, R-A, N as in Nancy, C-I-C.
Okay, and you are a registered nurse at the Orange Park Medical Center emergency room, is that correct?
Yes.
Okay. This taped interview is with regards to the in-custody death of Daniel Linsenbigler, white male brought in at approximately 10 o'clock this morning. Amanda, you were the registered nurse working in trauma room 2? And when Mr. Linsenbigler was brought in, can you just basically tell me when he arrived, or what the rescue told you prior to bringing him here? What did they call in?
Yes, rescue reported that the patient approximate dying time was 9:13, and that was in jail. They arrived on scene and reported the patient was in PEA, which is pulseless electrical activity.
Okay, thank you.
They began CPR and began transporting the patient to us. They intubated the patient with a king tube prior to arrival, and they gave approximately 7 rounds of ACLS, so that's 7 doses of epi prior to arrival. They did shock once prior to arrival, and the remainder of the time the patient was in PEA. On a pulse check, when the patient arrived at 10:04, you may continue with this, what we found?
Yeah, go ahead.
We did a pulse check when the patient arrived at 10:04 and found the patient to be asystole. At that point, we continued CPR and started ACLS drugs. We gave a dose of epi and a dose of bicarb at approximately 10:07. We did another CPR check following those medications and found the patient to remain in asystole. During CPR, patient was re-intubated with an endotracheal tube, size 8, 24 inches at the lips. We gave one additional round of epi and bicarb at approximately 10:11. We did another circulation check 2 minutes following, and patient remained in asystole. At that point, time of death was called by a physician at 10:14.
And what position was that, ma'am?
Atlasey, Attlesey.
Okay, so Mr. Linson Bigler never was responsive, never did say anything.
No.
And when he arrived, he was unclothed, just like
he was
like
completely
he is right
unclothed,
now.
no belongings.
Okay. Okay. Anything else that you would say that I might have missed? Anything like that?
No, we don't have a whole lot of information as to the circumstances before he arrived, other than that Clay County Fire Rescue reported that he was in a restraint chair.
Okay. All right.
And that's it.
Okay, that'll conclude the interview. The time is 11:48.
Okay, today is the 12th of March, 2013. It's about 12:50 p.m. I am Special Agent Rusty Rogers of the Florida Department of Law Enforcement. I'm conducting a criminal investigation. This interview is being conducted at the Clay County Detention Facility in Grand Coast Ranch, Florida. The person also present on the interview is Detective Tom Barnes from Clay County SO. Before we get started, I'd like to confirm this statement is a voluntary statement, that no one has threatened you, coerced you, or induced you to give this statement. Is that correct?
Yes.
Garrity, we discussed Garrity, and I want to now read you a statement. Has anyone from your agency commanded you to participate in this interview?
No.
You should understand that this is a criminal investigation independent of any departmental administrative inquiry. Your participation in this interview is completely voluntary. You do not have to participate, and there can be no administrative repercussions if you refuse to participate. Do you understand that your agency cannot compel you to participate in this interview, and that your participation is strictly voluntary?
Yes.
Okay. Having that in mind, do you agree to give this voluntary statement?
Yes.
Okay. At this time, I'd like to place you under oath. This will be a sworn tape-recorded interview taken by a law enforcement officer pursuant to Florida State Statute 117.10. Please raise your right hand. Do you swear or affirm the statement you're about to give is the truth, the whole truth, and nothing but the truth?
Yes.
Could you please state your full name and your date of birth?
Robert William Heaps II, May 29th, 1960.
Okay, and you currently work for Clay County Sheriff's Office?
Yes.
And what's your occupation?
Detention Bureau Sergeant.
And do you have a cell phone number that we can use to contact you?
I do. I don't know it off the top of my head.
We'll get it later. It's no big deal.
I can get it.
Okay. Can you give me just a quick background of what your education is?
High school education, Associates Applied Science, and Bachelor of Arts.
Okay. We're conducting a death investigation today, and I want to show you a photograph of an inmate, Daniel Joseph Bigler. Is that the inmate that you had contact with today?
Yes.
Okay, Sergeant, in your own words, I understand you probably had a lot to do. In your own words, just tell us what you were aware of, what happened, and what your participation was in this thing.
Okay. From start to finish?
Yes, sir.
Got a call on the radio earlier this morning saying that to come to confinement.
You know about what time that was, roughly?
I couldn't tell you. It's been a blur. So I went up there. It was earlier today. Went up there to see what was going on. And when I came in, Deputy Bloodsworth and Deputy Holtzman were over by cell 2. Deputy Holtzman was talking to the inmate in the cell, and he seemed pretty agitated, and they filled me in. They said that just prior to that he'd been banging on the door and the walls, or I don't know if he was hitting his head. They didn't say, but he had been banging, probably his fists.
Okay, before you got
kicking,
there?
Kicking, banging.
What did you personally observe when you were there?
When I got there, Deputy Holton was talking to him. He seemed pretty agitated in the cell, and we were just going to go in and talk to him. So after he spoke to him for a few minutes, we said, "Hey, just come on over and stick your hands out the flap. We'll cuff you up. Come in and talk to you for a minute."
And what's the
We'll
reason
try to
for
calm
that?
him down. Just try to keep him calm and keep him from reoccurring, coming back out. Maybe counsel with him a little bit. Say, hey, just calm down. I don't know why you're banging on the door and stuff, but to get him in a more calm state. Get up close to him so you can have a conversation with him. And so he said, no, I'm not going to do it, and refused. And Captain Waugh came over to the flap, and don't know what he said to him. I don't know if he said anything at all. Opened the flap, and he might have said a few things to him. And then he went back away from the cell, and he shut the flap, and the inmate started banging again on the door. And I don't know if he was what he was trying to do, but he was hitting it really hard, and could have harmed broken his hand or whatever. I don't know if he was using his hand or his feet at that point, because I couldn't see in the cell. The flap was shut. So we went back over there, and the captain said, give him orders to cuff up. And so we gave him orders to cuff up, and a few times, and he wouldn't. He stepped back in the cell and just took a defensive stance. And so at that point, we said, let's go get him, And Holton had got a spray, sprayed him. And
Okay, describe for me what's happening when he sprayed.
the inmate was, he started covering his face. I mean, he just started going like this. Once he started spraying him, he, started pulling away and covering.
You ever try to hit one of you or anything like that?
No, not at that point, no.
Okay. What happened next?
They just got a hold of him and brought him out of the cell, put him in the chair, and we got him strapped in.
Then what happened?
Then he was, since he had OC spray on him, he was spitting out, stuff was running down his face, snot, and was running down his face and spitting out, so they just put the spit mask on him.
Did he try to spit on anybody?
I don't think he actively tried to, but he had so much phlegm in front of his mouth that, him yelling and screaming, there was, stuff that could have gotten on somebody or affected them while we were, around him. So they put the spit mask on to eliminate that. And I was in there for not too much longer, and I went out and continued to make my rounds and stuff through the jail.
Okay.
And they started the watch on him, and and I told him, I said, when you calm down, we'll put you back up. I said, I'm not doing that. You take me out, and I'm not coming down unless you take me out. I said, well, you have to be calm before we can take you out.
Mm-hmm.
And I said,
take him out of
this chair, get him in the shower, decontaminate him. That's what we normally do. Once they're calm, we'll get them out of the restraint chair, get them decontaminated, have the nurse check them, and then put them back up.
Did you ever get to that point with him today?
That he calmed?
No. Did you ever get to the point where you took him out of the chair, took him in decontamination and everything?
No, we never got to that because he was refusing. He was still agitated, yelling, and he said, I'm not calming down unless you take me out.
So he remained in the chair?
So he remained in the chair.
Do you know how long he was in the chair?
Well, I mean, about an hour, I guess, before I was called back in there, approximately. I don't know the exact time. So like I said, I wasn't documenting the times. The deputy up in the Signal 60 booth was documenting all the increments of times when things occurred. So.
What else can you tell us?
I got called back into confinement, like I said, a while later, an hour or so. And when I went in there was several people, the nurse, and several other people trying to get him out of the chair. They
took him out of the pro restraint chair, got him on the ground, and initiated CPR.
Okay, now were you there when they took him out of the chair?
Yeah.
What-
I just walked in as they were getting him up and out. They were loosening the restraints.
Describe what you're seeing.
He was sitting in the chair, and there was several officers and a nurse around him, and they were getting him out. They were just loosening all the restraints, getting him out. And as soon as they got the restraints loosened, they lifted him out of the chair and laid him on the ground in front of it.
Did he seem to be moving or anything like that?
No, he wasn't moving.
Did he seem lifeless?
Yeah.
He did?
Yes.
Was he responsive?
No.
At all?
No.
So he basically was lifeless when they took him out of the chair?
Seemed like it. Yeah, he wasn't moving.
Based on what, I'm not trying to put words in your mouth, just based on what you saw.
Yeah. He wasn't really...
You saw something different?
He wasn't doing anything.
Okay.
They were doing all the lifting and everything. And
could you tell if he was breathing?
When I got over closer, I really couldn't tell because I got the ambu bag on him and everything. And so they were assisting while they were doing CPR.
Okay,
So
what do you
at that
see?
point, I couldn't see if he was breathing.
What do you see?
The times that I was able to see what was going on, they were just, they put the defib instrument on him.
Do you know who did that?
Nurse Glenn. Yeah. She took the pads and put them on. And
Did
so,
she shock him?
So it could analyze. It's automatic. I don't think you can manually shock somebody. So it just analyzes the whatever it can get from the person.
Was the speaker on? Could you hear it?
Yeah, I could hear it. It was telling it.
Did it ever say move away from him?
Yeah, it did.
Okay, that's what it normally shocks.
Several times, yeah. So, it did that several times.
But you didn't have anything specifically to do with that. The nurse would know exactly what was going on because she was...
Exactly. They were already working on him.
At that point, you were kind of like oversight or supervising.
Well, I was just trying to stay out of the way.
Right, okay.
And if they needed anything, to get it for them.
Okay.
So I was just standing off,
What else can you tell us?
They worked on him until rescue showed up, and then rescue began their efforts. Then my lieutenant asked me to go get some crime scene tape, so I went to go find some of that. Came back, rescue was still working on him.
Was it? Do you have an internal rescue unit, or did it come from outside?
No, it was Clay County Fire and Rescue.
So you don't have a rescue unit here inside the jail.
No.
Okay, so it came from outside.
Yeah, so they were still working on him, and they eventually took him, put him on the gurney, and wheeled him out. That was it.
Is there anything else you can think of that happened?
I may, but I can't think of anything right now.
Okay. Yeah, well, I'm going to give you a card with my number on it in case you think of something.
All right.
Do you have any questions for me?
No, I don't.
Okay. This concludes the interview.
Today is Tuesday, March 12th, 2013, approximately 12:25 hours. I am Special Agent Powell with the Florida Department of Law Enforcement, and I am here to interview Jenny Glenn, who is a nurse at the Clay County Sheriff's Office. And correct, Jenny Glenn? Mm-hmm. Okay. Okay, so we're here, I guess, an inmate by the name of Daniel Lissenbigler.
Yes.
Is that about how you would say it?
Close enough.
Okay. 19-year-old white male, and was pronounced deceased a little while ago at the hospital, and I'm just interviewing Jenny on what you saw and what transpired. So what time did you first have contact with Daniel today?
I'd say about 8 o'clock in the morning.
Okay.
Doing my med rounds. When I came in, he was already talking to the door, and Mr. McDade, or Officer McDade, went over and opened the flap to talk to him, the lower flap and the upper flap and everything. They sat there and they talked for a little bit, and he was complaining that he hadn't gotten a pencil. Well, he was a signal 60.
Which signal 60 is?
Suicide.
Okay.
So we have to precautions. And he couldn't get a pencil from anybody. He was getting irritated with this, and he wanted to be on the doctor's list. And the nurse told him last night he was going to be on the doctor's list. And Mr. McDade, said,
what does the doctor's list mean?
Our doctor's list is who we put on for the doctor. Doc was coming in today, so we were going to kind of get him down if he was having these problems, which, he was starting to become more irritated, and we didn't think the medication was working with him.
And what medication?
It's valproic acid.
And you had given it to him?
I'd already gave it to him while Mr. McDade was talking to him. I gave him his valproic. He had no problems taking it. He said, see, I'm taking my medicine. And he took his medicine and gave me back his cup. And then he continued to talk with Mr. McDade. And then he started screaming and yelling all of a sudden at Mr. McDade. And he said, okay, he goes, I'm not going to talk to you.
And Mr. McDade was outside?
Oh, yes, outside the cell.
The cell. And then Daniel was inside, and he was giving it to him through the
flap. We give it to him the flap. Right?
Okay.
And so Officer McDade just said, okay, I'm done. Because he said, I'm not talking to you, and you're yelling at me. So he closed the flap back up, and then that's when he got really angry. And so we continued our med pass when he started beating on the door. And it got to the point where Officer Bloodsworth came over and had to close the flap again because he had hit the door so hard it popped open the magnetic flap. And as you watched him, he just kept hitting the door.
What was he hitting the door with? Could you tell?
No, I wasn't over the camera, so I had no idea what he was really.
Right.
I tried to go over there to see, but by that time, he had already kind of stopped, and you just saw him kind of like this at the,
And was taking a fighting stance?
Almost like a fighting stance, like he was either going to kick, hit, something. So I said, okay. I said, get him out of there. I said, put him in the chair before he breaks a hand, before he breaks a foot. I said, just put him in the restraint chair, and I said, we'll get him to see the doc today. I said, we'll get him down there. I said, what we can do. I said, or I'll call doc and see if we can get him a Haldol injection, something to calm him down,
Mm-hmm.
And so the officers went over to say, hey, cuff up.
And what officers?
Bloodsworth. I don't know if I'm going to name. I heard a few came in. I know Holson came in, but he came in a little bit later. But they hadn't got him out of the cell yet. Heaps, you have to have a supervisor. Heaps came in.
And that's Sergeant Heaps.
Sergeant Heaps.
Okay.
And I don't remember. I can't remember if Acosta was there or not. I don't think Acosta was. But I know it was those three, and then I had Officer McDade there too.
Okay, so the three. So the original officer you were with was Officer
McDade and Officer
McDade
and Officer Bloodsworth.
Okay, those were the original officers. So they were there also for the extraction.
Right.
And then Sergeant
Heaps came in.
Sergeant Heaps.
Mm-hmm.
Okay, he arrived later, just a little bit.
He came in right before they were trying to get him to cuff up.
Okay.
And Sergeant Heaps was trying to get him to cuff up.
What does cuff up mean?
Bring your hands to the flap.
Okay.
So they put the cuffs on.
Okay.
And he would not do it. And they said,
so the three, McDade, Bloodsworth, and Sergeant Heaps, were trying to get him to put his hands outside so they could cuff him.
Right.
Okay.
And then that's when Holson ended up coming in after these three were talking to him.
Okay, Officer Holson.
And then Holson tried to talk to him to say, come on, man, just, come on over and cuff up, talk to me, man, talk to me. Because he's pretty good with the inmates. He can usually get them to do things, And he was not.
Where were you standing at?
When they start to have these little problems, I push my cart over to the middle booth where everybody sits.
Where the security cameras are?
Right, where the security cameras are. So I push my cart over there, and then I stand in there and I watch the screens.
Okay.
I see what they're doing.
So you can see inside the jail cell.
And then then if they go in, I'll turn around ready for whatever might happen to anybody. That I'm right there for them, an inmate, officer, whichever. And so the next thing I know, they're rushing in on him. And
so the four of them go in?
As far as I know, the four of them go in, and they pull him out.
Now, were they saying anything? Did you hear anybody saying anything?
They pretty much were telling him, to stop, don't resist, and he was literally kicking and flailing when he was trying to pull with his hands and his feet, trying to pull them off.
Yeah. Okay.
And he has the smock on, that Signal 60 green turtle-looking smock.
Okay.
Okay.
All
so,
right.
They're having a hard time.
And they're in the cell now trying to bring him out?
Yeah, they're bringing him out.
To put him into the chair?
Into the chair. They have the chair parked right there next to his cell, so they could automatically...
Now, do they wear any protective gear when they go in there?
Most of the time they wear just gloves.
Gloves, okay.
That's pretty much it.
Right.
And then they brought him out, and they set him in the chair, and that's when he started crying and everything, saying, don't put me in here, And they said, just, you're going to hang out here for a little bit until you're good. You're going to be good for a little while, and then they'll let him out. And then I finished my rounds. He was still yelling and screaming how mad he was being in that chair and everything. But
Now, how long did it take? I mean, you guys started, what, about 8:15? About how long was, about what time was it now?
I think about 8:30.
Okay, so about 15 minutes?
Me and Mr. McDade started making, because McDade, he kind of helped out a little bit, but, you know, he was mainly with me most of the time. So as soon as they got him in the chair, he came back with me, and we finished up the med rounds on the other side. And finished our meds rounds up top. But, you know, during this time, I didn't see when they pepper sprayed. Okay. I don't remember when they pepper sprayed.
So you don't know anything about, I mean.
You know, I knew, I started smelling it. Okay. That's how I knew they pepper sprayed him. And, because I was coughing and hacking.
And they would have somebody would have pepper sprayed him when he was inside the cell?
I think inside the cell.
Okay. But you don't know, you didn't see that?
Yeah, because where he would know, I didn't see it. I didn't see it. Because, you know, if you have four big men in there. And then you don't know what happens really. So I just know I saw them when they were coming out, and then it wasn't until after the fact when he came out of the cell is when I started smelling the pepper spray. When he got in the chair. Yeah, when he got in the chair.
When Daniel came out of the cell. Okay.
Right.
And that's when you smelled it. Okay. And then what was Daniel doing while he was in the chair?
He was just talking out loud, saying how he didn't want to be in this chair and how he'll be good. And then he started talking to Jesus a little bit. That's his thing. He talked about the Bible and Jesus, and that it was.
Has Daniel ever been in the chair before?
No, that was his first time.
Okay.
That was his first time because we didn't have really any problems with him. He'd go off on a different attitude, I guess you would say. That's the skits. I'm thinking whatever his mental condition was, it was where he would be in one frame of mind where he's talking to you really pleasant. And then all of a sudden, if you said something that he didn't like or one word off, then it went off. He went off. You know, that's how quick he snapped.
So did he ever act violent in the cell, or did you ever see any violence from him before?
No, that was kind of the first one, but I haven't worked in the last 3 days either. So when I saw him Thursday, he thought he was Jesus. Okay. So, you know, I mean, so we made sure he stayed in confinement after that. Yeah, I smelled the pepper spray afterwards, and me and Officer McDade finished the med rounds. And as we was coming back down, because I have to pass him as I come back down.
So you keep him in the chair outside the cell?
He was sitting, you know where the officers, the security cameras and everything are, the steps right there. He was sitting in that stairwell that they have that comes down right in front of him.
Like underneath that?
He's sitting right there. Okay, so they have visual on him. You know, they like to see. Anytime I've seen anybody in the chair, they always have him either back in their cell on the camera. But I think they left him out because of the pepper spray. They wanted the air, you know. But they kept him right there where they could physically see him and talk to him if they need to.
And you never checked him out anymore? I mean, with the pepper spray, you didn't even.
No, because he was still agitated.
Okay.
And and when he calms down and everything, I would come back up and check him, because I always check when the restraints have been on, make sure they're not too tight or anything like that. But he'd only just gotten in the chair. And I had him going to come see the doc anyway. And I said, Officer McDade, I said, if he's cooperative, I said, bring him down to doc if you think you can. If not, I'll see if doc can come up here, you know. And he said, okay. He goes, well, I'll try. He'll probably work with me if he knows he's coming down to see doc. That's what Mr. McDade said, you know. So as I was passing by, he's sitting in the chair, and I looked over at him, and he said, I'm fine, I'll be good, I'm fine, you know. And that was the last words I heard from him, because then I had left confinement.
And so you were done?
I was done. That was it. And then that's when I got the...
And about what time was it that you left?
I'd say probably about between 8:40, 8:45.
Okay.
Yeah, it wasn't that... I mean, it just felt like I got downstairs and...
And you did your rounds and...
Did my rounds. Hadn't even finished getting to sign off everything.
Okay. And then what happened?
And then I went downstairs and I started taking vitals for Doc's Day, because we have to take all the vitals for everybody he's going to see. And then I got a phone call, or not a phone call, but on the radio it said, you know, for me to come up, inmate unresponsive.
Okay.
I thought, oh crap. Okay, so I ran and got all my gear, which is, you know, our emergency bag and the ambu bag and all this stuff. So ran up there, and he was got through the gates. He was in the chair, and me and Nurse Spinell went with me.
Okay.
And we
Nurse
had
Spinell.
Nurse Spinell was with me.
How do you spell her?
SPO.
Spinel. Okay, Spinel. Okay.
And we started walking in there, and he was sitting in the chair, and I yelled at the officers, "We need to get him out, get him out, get him out, get him out."
Now, did he have the spit mask on at that time?
No, the spit mask was off.
Okay, so you never saw him with the spit mask on?
No, I saw him when I was walking out. Out of the confinement.
Okay, so when you walked out of confinement, he did have the spit mask.
He did have the spit
You didn't
mask
see
on,
it
which
go
was-
on him or anything, or?
No.
Okay.
No, like I said, he was sitting in the chair going, "I'm okay, I'm okay."
And he had the spit mask on at that
He
time?
had the spit
Okay.
mask on, but he was talking.
Right,
you know.
okay.
But when me and Nurse Spinell walked in there, his head was back and the collar. You always know when something's wrong
Right.
with the collar.
And the spit mask was off, right? You
His
said,
back was
okay.
off, and I said, "Get him out of the chair." And we started yelling up and get him out of the chair. So we helped the officers trying to get him out of that chair and lifting him out. And I went ahead and started compressions and gave him some rescue breath real quick, and before someone could get me my mask and everything. And yelled at Officer Wolf to call 911. I said, and I wanted the AED, so I was yelling all this.
Okay, right.
I was trying to get these compressions going. And other than that, I just pretty much kept going with the compressions, and Nurse Spinell was handing me everything I needed, and I plucked stuff on as I was doing the compressions.
Okay, so you used the AED on him?
Tried to.
Okay. You guys did get down
there was nothing there.
Okay, it was
flatline.
Okay.
I said just one beep, just give me one beep, it would be shocking, and I couldn't even, there was not even a beep. So,
okay.
Yeah.
And then you guys, I guess,
we
FD
waited.
showed up?
Yeah, we waited and waited for the rescue to showed up, and I continued compressions until rescue took over.
Oh, did you? Okay.
So until they finished getting all the stuff that they needed to put on him.
Did Nurse Spinell help you with the CPR and the compressions?
Mm-mm.
Just pretty much you?
It was me and Officer Magellan.
Magellan? Okay.
He did the compressions with.
Okay.
We switched off. He did it for a little bit.
Okay.
And then I took back over when.
Okay.
After he.
How do you spell his name?
Oh God.
Magellan, you said?
Magellan. Good.
I'll find out.
Yes.
I'll find out.
First name Chris.
Okay. Yeah, we'll find out somehow. Okay, and then I guess the FD or whoever responded and.
Mm-hmm.
Okay.
Yeah, and I just have that feeling that he was gone. I mean, when I got to him, he had the strange looking collar to him.
Right.
Okay, but he was still beating sweat.
Right.
Okay.
Okay.
So I still think it might have been like an asphyxiation from mucus.
Okay.
Maybe from the pepper spray, where it's like the mustard gas. That's how they can asphyxiate people with the mustard gases. Right. So I just have that feeling it might have been that.
And then that with the mask did not help.
Did not. Yeah.
Okay.
Yeah.
Okay.
So that's what I'm thinking.
Right.
But hey, you can always be wrong.
Yeah, we'll find out from the autopsy. So he had never acted up like that. Daniel never acted up that bad before.
No, not that bad. Like I said, he ran around the cell calling himself Jesus and everything, and he was arrested for doing the same thing at a hotel.
Right.
According to the booking sheets, but other than that, we put him in D-wing for one day, and he took everything off and ran around the cell calling, saying that he was quoting the Bible, and
right.
So we said, okay, back to confinement with you.
So he's been in confinement pretty much the whole time he's been here?
Yes.
Okay.
Yeah, because at first he was talking real normal to you.
Right.
And he carried a normal conversation. I said, listen, I heard that you took LSD. I said, are you okay? And he talked completely normal, told me his medications that he took on the outside. This is all when he
Now, do you remember what medications he took on the outside?
I wouldn't be able to tell you.
Okay.
Because he had ADHD and some, he said he's got some mental issues.
Right.
I said, okay. I said, well, I'll get you on to see the doc. And he saw the doc. And plus he saw Bob McQueen, which is our Signal 60.
Like a psychiatrist?
Yes, he's kind of a psychiatrist.
Okay.
But he takes care of all of our suicidals. So he has long conversations with them.
Okay.
Bob didn't feel comfortable taking him off, so he remained on the Signal 60 on the suicide watch.
Okay.
But other than that, I mean, this is really. Teresa said last night that he was really starting. Our nurse Teresa, she said he's really starting to act up. She goes, she goes, I don't know what's going on with him. And I said, I didn't really have too much problems. He was talking to the door most of the day yesterday. Okay. But that's normal. He was quoting his Bible,
right.
And I said, but he got mad at Teresa on an incident. I think because he wanted to go see the doctor, and she kept saying, I'm going to let you see the doctor. And she told me that this morning. She goes, make sure he is on the doctor's list.
Okay, and he was.
And she hadn't put him on there, but she said, talk to him upstairs, see what you think, And I said, okay. After I saw him this morning, I said, we'll bring him down last.
Yeah.
That's what I said.
Right.
We'll bring him down
He
last.
just was acting. He was acting worse all day.
Right. Something just wasn't right.
Yeah.
You know, and even and he should then need to be on probably something else.
Right.
to
Now,
help with that.
what was the medication he was on?
Valproic.
Val. You know how you spell that?
VAL.
VAL.
PRO.
PRO.
I see.
I see. And you know how many milligrams or anything?
500 milligrams.
500 milligram. And
Twice a day.
Okay, 2 tablets a day. 1 tablet twice a day.
Well, yeah, one. It's 2 tablets a day, but
Okay.
the whole dose is 500 milligrams.
Okay. Okay. And that was the only medicine he was on?
That was all the medicine he was on right then and there.
And what does this medicine do?
It tries to stabilize your mood.
Okay.
Okay.
Okay. So it's a mood medicine.
Mm-hmm.
Okay. All right. Now, anything else? I mean, you're pretty thorough on everything that you saw.
Mm-hmm.
I mean, anything else you can think of?
No, that's pretty much how everything went down this morning.
Okay. Now, somebody gave him an IV or something, but that was the FDA.
That was rescue. That
okay,
was
rescue got here. Okay.
Because when I was doing the chest compressions, they continued to. They put their pads on. They took our pads off.
Okay.
I was doing
They did their thing.
Yes, and they just kind of worked around me, and they said, "Okay." They said, "Take a break." And
Okay.
I said, okay.
Wow.
Yeah.
How long were you doing? How long was it? How long were you down there before rescue got there?
You'd have to check the logs.
Okay, so
whatever time I came into that cell, I was
Right.
doing the chest compressions from then on, and Magellan helped out for a few minutes,
Yep.
and
then
he
most
started
people-
wearing down,
Yeah.
and I said, and then I just took right back on.
Okay, and you just pretty much did it
And
the
then
whole time.
Acosta, I know Acosta. Who else was up there? Acosta was doing the breathing. I think it was Costa and Nichols. Costa and Nichols was holding his head. And
Okay.
using the back.
Right. Costa Nichols assisted with the breathing.
Mm-hmm.
Okay.
Yeah, they kept their cool. I was very
Good.
I was very proud.
Sounds like you did a good job also. And you've been here about 7 years, had 6, 7 years, right?
Right.
Okay.
2007, May of 2007.
Okay.
I'm trying to calculate anymore. Building up.
Just say, yeah, right. May 2007. And what kind of nurse are you?
I'm an LPN.
LPN? Okay. Okay. All right, Jenny, anything else you can think of?
No, that's pretty much all I can remember out of the whole thing.
Okay, excellent. It is now 12:44 hours, and we will conclude the interview with Jenny Glenn.
This is Agent Greg Holycross at the Florida Department of Law Enforcement. I am at the Engine 20 location in Green Cove Springs with Lieutenant Phil Kreider of the Clay County Fire Rescue. The address here is what, sir?
God, if you wouldn't have asked me, I could have told you. 303 South Oak Ridge.
303 South Oak Ridge. And a telephone number here, sir?
It is 904-284-4290.
Thank you. This interview is being conducted in conjunction with the in-custody death investigation that occurred today at the Clay County Sheriff's Office involving Daniel Lysenberger. And this will be a sworn statement, so I want to swear you in, Lieutenant. If you will, raise your right hand. This is a sworn tape-recorded interview taken by a law enforcement officer pursuant to Florida Statute 117.10. Do you swear and affirm that the statement you're about to give will be the truth, the whole truth, and nothing but the truth?
Yes.
Okay. Lieutenant Kreider, today you were working as a lieutenant on Engine 20, and you were dispatched to the Clay County Jail for a call. Is that correct?
For a cardiac red.
Okay. Cardiac red means person's there with no heartbeat or
no
something.
heartbeat,
Okay.
cardiac arrest. Yes.
Okay. Do you know approximately what time that was? You were dispatched approximately.
That was 9:13.
Okay. All right. And who else was in on Engine 20 with you today, sir?
It was Scott Moody and Matthew Hoff.
Okay. Once you arrived at the Clay County Jail, kind of walk me through what happened. Where did you go?
Okay, we went, after we got there, we went upstairs through the elevator and went into, I believe that's the isolation area.
Into the cell block?
Into the cell block area.
All right.
And I'm not sure exactly who was doing CPR, but there was one person that was doing CPR and one person was using a bag valve mask, ventilating the patient. They were doing good CPR, so we didn't stop them.
Okay. Now this was taking place inside of a cell or out in the general area?
Out on the floor, right next to the observation area. I guess that's what
the
it's called.
stairs going to the observation. Okay.
Yeah, it was right out there. But he was laying on the floor naked, with them doing CPR on him.
Okay. Initially, just give me a little story of what did the corrections officers tell you had happened?
They said that earlier he was beating his head on the wall, and he got pepper sprayed, and then they put him in the chair, and he was fine in the chair, and they said he was talking, and about 10 minutes later when they came by, they found him unresponsive in the chair. And that's when they pulled him down, put him on the floor, and started CPR, from my understanding.
So about 10 minutes had gone by from the last time they had heard him or seen him with similar activity.
They said at the most was 10 minutes.
Okay. Do you know where the chair was? Was it out in the open area or in the cell? Or?
No, I didn't notice the chair.
Okay.
Right? You know.
Did they say where it was? Was it in the cell, or did they ever say?
No, I think it was out in the open area, but
okay.
I don't know.
Okay.
I don't know.
All right. Did anybody say how long he had been in the chair to you?
No, they didn't say how long he'd been in the chair, but they said that that the last time that they spoke to him was about 10 minutes.
Okay.
And then I think they said he got quiet.
Okay. Do you know what time did they say what time they pepper sprayed or what time he started banging his head or when this incident precipitated?
I thought somebody said that it was about 8:30, but I really don't know. I'm not positive on that.
Okay. All right. Once you established that, you let the corrections officers do CPR in the bag in it.
While we got our equipment set up
okay.
to start working them.
Okay. And then what did you guys do?
One person secured the airway, and another
intubated.
He was going to intubate, but then we have like a EOA, but it's a king tube that they inserted the king tube in. I listened. He had good breath sounds in all fields. The other person was hooking up the monitor, hooking the patient up to the monitor because they had him on an AED, and it said continue CPR.
Right.
So we wanted to see what we had.
What did do you recall what your monitor initially showed?
It was mostly asystole, there was maybe 6 beats a minute at the most. So we continued the CPR and started an IV on them, and we pushed epi on them, one drug, and then we set up a pacer to start trying to pace them, and we set that at 70 beats a minute.
Is that an automatic?
It's like a pacemaker.
Mm-hmm. Okay,
and we increased the milliamps, the voltage that was to to it up to 120, and we weren't getting any capture with that.
Okay.
So we weren't feeling a pulse, and we weren't. There wasn't anything that the heart was catching on.
Okay.
So we gave him another epi, and it looked like that IV had blown. So we went over to the other arm and started another IV in the other arm.
Okay. Okay. He never became responsive at all.
Never.
The time he was there, and he was never alert to say anything.
Nope.
No cardiac activity other than very minimal beats per minute.
Very.
Even with you guys doing your all of your emergency measures. Okay. After a few minutes of trying this, then rescue
arrived.
15.
Yeah.
Arrived.
I'm not sure exactly what time they got there, but when they arrived, we worked them probably another 10, 15 minutes, and we stopped CPR, and he still had to beat here and there, so they went ahead and we loaded him up and transported him.
Transported to Orange Park. Okay. All right. During the time you were there, do you ever recall any of the corrections officers saying anything, and I'm going to paraphrase this, other than he was in a cell, he was hitting his head inside the cell.
Yeah.
Is that correct?
That was my understanding.
Okay. And that he was pepper sprayed and then put in a restraint chair.
Right.
And after he was put in the restraint chair, there had been about 10 minutes gone by when they didn't hear him or see any activity.
And that's when they checked on him.
When they checked on him, they found him unresponsive and called you guys. Okay. All right. I think that's everything I need, because rescue 15 transported, and at that time you were complete with what you had done. Okay. All right. The time is 5:45. We'll terminate the interview.